sector, occupational health and safety in the informal sector. And today we are marrying two very hot topics, which is heat stress and the informal sector. So this webinar has been brought together with the collaboration of other organizations. And the first session is titled Introducing the Global Coalition for Informal Workers' Health and Wellbeing. And the short version is GCIW, the acronym. So it now gives me great pleasure to introduce our first presenter from the USA, Dr. Akran Salman Navarro. Akran is a physician trained in occupational medicine with graduate degrees in ergonomics and biomechanics and a postdoctoral fellowship in population health and healthcare delivery science from New York University. And his main affiliation is with the New York University Grossman School of Medicine, but he also has other academic institutions globally affiliated. So his main focus is promoting occupational health to vulnerable working populations via multiple global interventions, and more recently in New York City Health and Hospital, which is the largest public health system in the USA. So national recognition of his work appointed him as a member for the CDC NIOSH NORA Musculoskeletal Health Council, and internationally he's a member of the technical committee for the musculoskeletal disorders and the technical committee for informal workers of the International Ergonomics Association. Within the International Commission on Occupational Health, which is CRUN, he's the current chair of the ICE for health workers. I apologize. And he leads the topic of occupational health for migrant workers in the ICO working group on the future of decent work. More recently, he's one of the leaders spearheading the establishment of the new coalition, which is the Global Coalition for Informal Workers' Health and Wellbeing, GCIW. This coalition is dedicated to safeguarding the health and well-being of informal workers across the globe. Its members unite to address the unique challenges which are faced by individuals engaged in informal employment, which is around 60% worldwide, recognizing their invaluable contributions to communities and economies worldwide. So, Akran, we are especially grateful to have you here with us today. I know that you'll be traveling later on, so we are grateful that you can present. So I hand over to you. Please go ahead. Welcome.
Thank you so much, Claudina. Thank you so much to the South African Society of Occupational Medicine. It is my great pleasure to be here to share experiences and humble knowledges and work that we've been doing together with many colleagues to advocate and to highlight the importance of informal and migrant workers within our specialty. Can everybody see my slides? Yes, okay. So without further ado, I declare no conflict of interest. And I want to start by talking about work as a social determinant of health. This is a topic that is very, it's not spoken enough. And the reason is because when we talk about social determinants of health, usually international agencies and the scientific literature itself always talks about education, access and quality, healthcare and quality, neighborhoods we live in, social context, and economic stability. Really, social determinants are the conditions in which people are born, grow, live, work, and age, shaped by distribution of money, power, resources, etc. But interestingly enough, none of these domains mention work. But as we all know, as experts in occupational health, work is implicit and actually a driver of all of these highlighted determinants of health. Work is included in economic stability, in built environments, in social and community contexts, in education and access to quality education or healthcare. So work is part of our lives, and it's implicit in all of these social determinants and drives health as we know it. Influence goes beyond conditions, working condition. I mean, it even circumscribes life itself. I mean, physical, the income, housing, access to health insurance, self-esteem, emotional stress, social status, connectedness, free time, and all of them influence other social determinants of health and can affect family, communities. Lower levels of employment does not really translate into healthier societies. I mentioned this last one because a lot of countries, societies, local governments usually use unemployment or overemployment as an indicator of a successful society. So when they say, "Hey, we're creating new employment, now unemployment rates have lowered," they see that as an achievement, which it might be. But the real question is, what type of employments are you creating? Are you creating employments where workers are going to get sick, workers are going to die? So for us, the creation of employment is not enough. For us, the creation of dignifying and safe workplaces is what should be the objectives. Now, we can use work as a fundamental cause of a determinant of health, or as a fundamental cause of being healthy at workplace or not. We can also use work as an intervention. We can design workplaces or redesign workplaces to intervene into a situation that we're trying to improve and use it as a determinant of health. It can also be a conceptual bridge between one and the other, and we can be using it more on a macro level to work on population health as a whole and not individual. And nowadays we're talking about post-work. I mean, is when people retire, do they stop contributing to society? Are they still working? So, the concept of work goes beyond even the actual employment per se. And we're going to speak about this more when we go into informal work. I've been dedicating my whole life in work and vulnerability. So there's many types of vulnerable workers. We have, aging workers, child labor, which is more common than we think, than we know. Informal workers, migrant workers, which is the focus of today. But we also have, vulnerability within intrinsic vulnerabilities. For example, a pregnant worker, seasonal workers, day laborers, what we call jornaleros, and now the gig economy, which I'm going to talk a little bit about later on as well. Now, migration itself can be a social determinant of health. I mean, migrant legal status, there's individual factors, lifestyle factors, living conditions, working conditions, social community factors, governance and socioeconomic conditions. How being a migrant worker per se pushes and drives these social determinants and their contribution sometimes is not reciprocal to what they really contribute to society. Now, there's many reasons why people migrate, and the International Organization of Migration has described 4 phases, and we can hypothesize that all these phases are directly or indirectly work-related. When you decide to migrate, there's a pre-migration phase. There's reasons for migration. There's voluntary migration, forced migration, but at the end of the day, it's a phase that it's pre-migration determined. There's a movement phase. There's an arrival and integration phase, and in some cases there's a return phase also, and we're going to give some ideas on this later. Now, there's cross-cutting issues, gender, age, genetic factors, socioeconomic factors. But at the end of the day, what we look for is migrant workers' well-being. And we've been working on this for many, many years through ICO with collaborations with the International Organization of Migration, among other organizations through many years. Now, this is an infographic that it's very busy, but the reason I just want to highlight here that, for example, 41.8% of people who migrate to the United States are due to work. Now, you can argue that some people go for schooling, go for family, but then ultimately people need to work to bring food to the table. So directly or indirectly, you are, even if it is or is not your main objective for migrating, you will be working at some point. Now, why does informal work matter as a social determinant of health? Just like we just mentioned that migration can be a social determinant of health itself, now we've been raising the umbrella on this awareness, and we've been focusing lately on informal. Why? Because a lot of the informal workers are migrants, but some informal workers are not migrants. You can be an informal worker and you're a national, but a vast majority of the informal works in the world are also migrant workers. So the focus on informal work includes the migrant workers as well. And so you can say, hey, informal works also matters as a social determinant of health. And we can talk about lack of protection, social protection, unsafe working conditions, low unstable income, social exclusion and marginalization, gender impacts. And within, I'm not, the idea is not to read the whole slide. This is going to be shared, but it is important to understand that within the lack of social protection, there is a lot of things that are very important, like unemployment benefits, for example, health insurance. And within unsafe working conditions is what I call 4D jobs. What I'm going to explain more later. And then, there's low and unstable income as well. And it's very important because we at the Global Coalition of Informal Work, which I'm going to describe at the end of the presentation, have been talking about this in detail and extensively. Then you ask the question, what is the solution for informal work? Is it formalizing workers? Is it including them within these social health systems within your society? So these are questions that we're asking and we're seeking answers. And that's why we are working on the coalition. Now, formalizing informal work sounds trivial, but it's very, very, very it's a topic that we should extensively study within our global coalition and within our scientific colleagues. I mean, there are countries around the world that 90% of the populations is informal. So maybe formalizing 90% of the population of a country, it's really not the way to go, but there are ways on how to include them in all these social protections of the country and address all these domains that I'm mentioning in this slide. Now, wearing my physician hat, and there's, of course, a lot of this is the Society of Occupational Medicine of South Africa, and I'm sure there's a lot of colleagues around the world that are here, that are clinical providers on occupational health. It is important to see clinically an informal and migrant worker when we see them and they're knocking on our door with some sort of an occupational disease or injury or a concern in their lives, and they seek medical care. I mean, there's language skills and communications, income, poverty, nutrition, malnutrition, accommodation and sanitations. We see it very often around the world, especially in agriculture. Access to healthcare. Do they even? We're gathering here to talk about. We're gathering here to talk about occupational health for migrant workers and informal workers, but do they even have access to any healthcare? I mean, in our practice here, in our health system, sometimes we get patients that are in their 40s, in their 50s, and it's the first time they even see a doctor. And they're like in their 50s or their 40s. And these are informal migrant workers. So it's a tangible situation that it needs to be addressed clinically as well. Now, a lot of these workers who are informal and migrant workers perform what I call, what I've been publishing and discussing for many, many years now, what I call 4D jobs. So the 4D jobs is basically a proposed term that we've been publishing for some years, which is actually the update of what is well known about of 3D jobs. So the 3D job that we've heard about for many years is an American neologism of an Asian concept that speaks about dirty, dangerous, and difficult work. Okay. Now, this comes from the Japanese expression katanai, kikei, and kitsui, respectively, which is, dirty, dangerous, and difficult. And, we've proposed a fourth D, adding the discriminatory aspect of these precarious work, and which makes workers very vulnerable. Because, ultimately, when a worker migrates or a worker sees themselves in an informal sector, there is societies and health systems exclude them from formality when it comes to healthcare and health access and what we call what we do as occupational health. So it tends to be discriminatory, and we should work on this to be inclusive and acknowledge their contribution to society and to our workplaces. So this is just a slide, a little bit of what I just described. So basically, we talk about, how these workers do dirty, dangerous, demanding, and discriminatory. Some statistics from from Norway. I mean, we see that there's a higher risk for repetitive motion, physical exhaustion, psychological exhaustion of migrant workers in comparison to national Norwegian workers. Here we see just an acknowledgement of the thousands and thousands of workers that unfortunately lost their lives in preparation for the Qatar World Cup, where they were, building the stadiums and the infrastructure and all of that, and most of them due to heat stress, which we're going to talk about in this session as well. A lot of them were migrant workers, informal workers, and when you see the four phases of migration, the returning phase, a lot of these workers who were kept alive or survived, there's tens of thousands of them back home with chronic renal diseases in dialysis and so forth. So these are things, this is just a snapshot of many news and publications, and they call them the World Cup's forgotten team. Within ICO, after when this situation happened back in the World Cup, we put out a statement also, on protecting the occupational health and safety of migrant workers, which I encourage everybody to read. This was a collaboration with Dr. Paul Schulte, who has been very, very helpful through the years on this endeavor. Now, contributions. How much do migrant workers or informal workers contribute? This is the big question that we are to seek and we are to acknowledge. For example, in New York City, despite the lower median earning from foreign-born New Yorkers, migrants contribute significantly to the city's economy and vitality. Immigrants own 52% of New York City's businesses, and that's around 22% of the city's GDP. So it's part of society, and these are very, very broad numbers. But the actual, this is something that I would encourage everybody around the world to start thinking about this. And we want to invite you to the Global Coalition of Informal Workers to work with us to actually come with some type of numbers, because numbers translate into implementation and dissemination of programs and policy and research. And we can talk about more numbers, for example, from IOM. I mean, not only what you contribute to the society that you're on, but how much do you contribute back home? A lot of migrant workers who are in the informal economy also contribute much to people back home. So somebody moves to another country to seek work and better life. A lot of them, if not all of them, also send money back with remittances. So we're talking about close to $1 trillion globally of money moving around. Now, you ask yourself the question: you contribute to the local society, you contribute to society back home, and are we being reciprocal or are we being discriminatory? That's the reason of the fourth D that we've been coining as a term. So you have someone that comes to a country, works on the informal society, contributes home and back home, but doesn't have the minimum conditions to be healthy, to have dignifying workplaces, or to actually have a name. A lot of them are living under the shadows, and that's something that we need to address as experts in this area. Global informal economy, Claudina mentioned it earlier. I mean, we're talking about 61% of the population. I mean, 6 out of 10 people who work in this world are in the formal economy. Just let that sink in for a second. So it's an estimate of 2 billion people working informally, mainly in developing and emerging economies. We have countries, like I said, that over 90% of the people are informal. And also seen widely in high-income countries. We always talk about the global south, but there's plenty of informality also in the global north and high-income countries, which we're also looking at with some colleagues. Informality puts workers at risk of vulnerability, like we spoke earlier, inadequate earnings, poor working conditions, lack of social security, lack of protection, occupational health and safety. And, this is something that, we are here together trying to address appropriately. Informal work in New York City, where I work, I mean, it's part of life. Here's we think about, we see street vendors are informal workers, lacking social and effective protection. Well, there are no statistics specifically in the city. We say that there's like around 10,000 to 20,000 New Yorkers making their living selling food only as a merchandise in the city streets. Here we have a photo from famous Mulberry Street in Manhattan from the 1900s, and this is the same block today. You see the same informality. So it's part of our society everywhere in the world, and we're working to dignify these workplaces and help them have the minimum benefits that you need as a worker who contributes a lot to society, to the culture, and to what we know as as New York City and other cities in the world. But not everything is bad news. I mean, there are really good initiatives around the world, and this is one of the things that we want to address with the Global Coalition of Informal Work, is have a place where you can bring all the good practices around the world into one arena and highlight them in a way that we can also mimic or include in our local practices as occupational health experts. I mean, there's an estimate of 10,000 what we call canners around New York City. People collect and redeem and deposit it to earn money. And and there's campaigns, for example, like we see here in the subway, show canners some love. So and not only you facilitate machines for them to introduce the can or the plastic, and then you get an immediate credit in coins or money, but also how much do they contribute to the environment? How much do they contribute to keeping the city clean and so forth? So, I mean, these are just a few examples of things that you should acknowledge, and not only acknowledge, but also highlight and help the dignity of these workers. There's all types of informality, not necessarily it has to be very precarious. There's informal actors and singers and artists, and there are there's initiatives like Under New York where they actually give them a platform for them to sing, perform, and actually entertain all the commuters around the city. And although they are informal, a lot of them are, I have to say, very, very, very good professionals and musicians. And we enjoy the music in the city when we commute. So this is other initiatives. This is the National Coalition of Day Laborers in the U.S., also supporting immigrant workers impacted, for example, in Los Angeles fires. This is some time ago. These are just organizations that also help to mobilize and support immigrant communities in many ways. Now, when we speak about informality, the first thing we think about is precarious work, dirty, dangerous, difficult, and rightly so. I mean, this is the majority. But now we're living in an era that, well, I don't like to say post-pandemic because COVID already happened many years ago. I think that I'd call it the new forms of work, but it did happen after the pandemic, right? So, new forms of work, is it informal? How are we addressing new forms of work and with the new generations? So these new forms of work are not necessarily dirty, dangerous, and difficult, but are informal. There's generation changes from the builders, baby boomers, Generation X, Generation Y, Generation Z, and now, like my children, Generation Alpha, which are under 10. They're built different. They're built different. Yeah, they think about being entrepreneurs, creating an app, working individually. And they don't see themselves, new generations don't see themselves working from 8 to 5 and reporting to HR and clocking in and clocking out. They want to do their own thing. So how are we as an occupational health society are going to address these issues, which are not here? It's not the future. They're here now. So, and there's many ways to see this, I mean, is it, we talk about the gig economy, platform economy, sharing economy. There's different types of economies right now that we're seeing informality as we don't usually see it, but we must include them in our practices and in our research because, it is informal work. It is different as we have shaped it through the years, but it is something that we need to understand. I mean, we're talking about that in right now, 33% of businesses use gig workers, for example. There's we talk about 86.5 million freelancers by 2027. Millennials and Gen Z prefer freelancing, for example. So how are we going to address this as occupational health experts? There are workers, they are working, and we do occupational health. So I leave that question in the table for us to discuss. And it's something that we also want to look into the Global Coalition of Informal Work. I mean, there's pros and cons. I'm not going to read this whole slide, but it's important to understand that within the pros and within the cons, we have to include them in our clinical practices. And usually, these workers are not going to knock on the door of an occupational physician to say, "Hey, I don't feel well. Can you please help me?" Or can you help me improve my workplace? Or can you please give me some recommendations for um, ergonomic situations I have in with while I work, or psychosocial situation while I'm working? So it is something that we need to think about because it's not the future; it's happening now, and these are workers and that deserve our attention and as experts in this matter. Now, you can talk about the new forms of work, is it, from the gig economy to talent economy. These are conversations that we're having. Um, and this is where we're going, precarity at work um, goes beyond physical. It is also mental, societal, and individual and intrinsic. So, and this is part of the 61% of informal workers that are in the world, and we must not only focus on the 39% formal workers. This is the vast majority nowadays. So, we're talking about the future of work in different institutions, and the world is changing rapidly. I mean, we're talking about how is artificial intelligence going to play a role in this? We should embrace it, and we should use it as a tool to understand and to contribute to this working society, and use it as a tool also to help shape our practice and to deliver care to these workers who are usually under the shadows. We've been working a long time under the leadership of Dr. Paul Schulte and many others who are probably on this call. I see there's 160 people over. Oh, there's a lot more. So probably a lot of my colleagues on these papers are on the call. I encourage you to read these publications. We've been talking about the future of decent work. What does this mean? How are we addressing what we know as informal work, migrant worker, and the future of decent work with the new forms of work? Within the paper, we describe pillars of decent work and also determinants of decent work. We spoke about work as a social determinant of health, and within the paper, we describe informal work, migrant work, among others. And when we speak about the pillars of decent work, if you see the first one, employment creation, we talk about precarious work, unemployment, underemployment, high quality jobs. So we looked at this in depth and in detail, and we determined these pillars to be used as a tool for everybody in their practice and in their future research. More recently, last year, we published a second paper, Furthering Decent Work, Expanding the Role of Occupational Health and Safety, and where we also looked at in depth not only the pillars, but also how are we going to address this now and in the future, which I always also encourage you to read. Here we see a Nepali migrant worker in India, very, very common, hand labor, manual labor. These are, this is one of the pictures that when we in Geneva in the International Organization of Migration, when we did a collaboration between ICO, IOM, and MADRI, acknowledging all my colleagues in the photo, and Diana, Cole, Chuck, and Dr. Paul Schulte. Unfortunately, a lot of these departments have been underfunded lately, but we're still working together to bring all this good work to our practices to improve the work of migrant workers and informal workers. Last year in Marrakesh, we've been talking about informal work for many, many years, and in Marrakesh in April 2024, we got in the triennial conference of ICO, we got together and we materialized the idea of the Global Coalition of Informal Works and Wellbeing. And we've been working on this, and it's now a reality. We're working on the nuances of registration, of gathering information, on the visual websites and other tools to deliver and disseminate. And basically, the Global Coalition of Informal Work, it will be dedicated or is dedicated to safeguarding the health and well-being of informal workers around the globe. We unite address unique challenges faced by individuals engaged of informal unemployment, around 60% of the global workforce, recognizing their invaluable contributions in communities and economies worldwide. We want to empower informal workers legally, dignifying their work and prevent occupational diseases. And we also have our missions to advocate, support, partner, and ensure the voices and concerns of informal workers that are heard and addressed in terms of health and safety and well-being and economic opportunities and equity in promotion. So we will be disseminating this information broadly. We will invite every one of you to be a part of this process. And we also encourage all the good work that's been going around technically in silos. And that we want to bring it together and highlight the good practices, highlight the failures as well, so we can learn from them. And also, very importantly, highlight in a participatory way the contribution that each worker does around the world in the informal sector, and their voices to be heard, that they are not in the shadows, that they are contributing, and they are deservings of dignifying workplaces and deservings of our recognition and our care as occupational health experts around the world. I want special thanks to the executive committee, Maggie Graff, Claudina Nogueira, Clive De Souza, who's also going to present today, and also many institutions that are contributing to this initiative: WeGo, ICO, IOHA, the IEA, and many others who are contributing, the ILO, among others, that are contributing to this initiative. And I'll leave you my email. You can also email any of us. And I thank you so much for the opportunity. And I'm here for questions if anything is necessary. Thank you so much.
Thank you, for your very comprehensive presentation. I don't see any open questions yet. With a question myself and the initiatives. How do you see, or how do you feel that this may impact your endeavors with the Global Coalition?
Can you repeat the question, Claudina? You're breaking up a little bit, please.
The question is, how do you feel that the global cuts in funding can affect initiatives like yours with the Global Coalition on informal workers?
Well, that's a good question. A very hard one to answer. And I'm going to start answering my question with there is a lot of uncertainty right now in our field, in public health and population health. But I think that these initiatives should move along and move forward regardless of what's happening geopolitically. Um, our world always has ups and downs, but the workers are there. They're a tangible reality, and the need for their health, safety, recognition, and dignifying work, it's always going to be there. So, I think that regardless of what's happening with fundings and defundings with different international entities, I think that we should move forward this with what we've always used as our main asset, which is the passion. Each and every one of us here in this call, I am sure that a lot of the work you do every day is driven by passion and driven by, our life objectives as occupational health specialists to bring dignifying work to everybody. So there is going to be, just to be pragmatic in the answer, of course, we're all going to be impacted, but we're moving forward regardless. We'll find a way. I'm sure there's going to be a lot of us in this call and beyond that would want to contribute to 61% of the global working population.
Thank you, Akran. Thank you very much. I'm wondering if there are any other questions. I don't see any open questions in the question and answer modality. I have a comment that's been posted in the Q&A, more than a question, from Tidu van der Madra, who says, the informal worker is by definition isolated and below the horizon. How to identify those people that are by definition willing and good employees? So I think what Tidu is saying is that informal workers are often invisible in many ways.
Mm-hmm. Yeah. So informality is seen different in every country. There's similarities. There are similarities, and the underlying issues are very similar and the same. But I think that to answer that question or comment there, we would have to discuss a little bit, what country are you from or what society are you embedded? For example, in India, around 90% of the population is informal. So it's part of life, it's part of society. But there are other countries that less than 1% it's informal. So it should be addressed differently. And I think our main ultimate goal is to, one, recognize them, and two, determine what is their tangible contribution in numbers. It's going to be a titanic job, but it can be done, and that will help us be reciprocal, like I mentioned in my presentation. You contribute to your local society. Migrant workers within the informal workers contribute back home, but who contributes with them? So that's on a broad scale, a little bit of what my comment to that comment.
Thank you, Akran. I have a couple of more questions that have come through in the chat. So one is a very broad one, which I'll read, but I'll read the second one as well, and maybe you'd like to answer them together. So Shanaz Ismail asks, how do we bring occupational health to the informal sector worker? And then Nomonde Mabuya has the following question. The ILO has proposed the 5R framework for decent work, which aims to reduce, recognize, redistribute unpaid care, to work and reward and represent paid care work. Have we seen any visible impact even within formal work systems?
So, interventions to bring occupational health to informal workers have to be tailor designed to the sector within the informal sector that we're addressing. For example, addressing the way garbage pickers work, for example, addressing the way home health aides work, addressing the way how gig workers work. So how do we bring occupational health to the informal sector? It is a broad question, but I think it has to be tailor designed to what you're addressing. I don't see uh, like a one size fits all for all types of informal work, because within informal work, although we're talking about very broadly, there's numerous of ways informality is presented. So I would say if you're an expert in occupational health, understand how informality works in your own domain, in your own society, which is predominant. How is it addressed now? And then tailor design preventive programs, working with local officials and working with healthcare system to address the specific risk factors of what is predominant within your society, and bring all the core values and core knowledges of occupational health towards that. So basically tailor design the interventions to whatever informality we're bringing. And to the ILO proposals of 5R, I cannot speak for the ILO, but I understand that I understand the framework, and it's a really important and good initiative. And it's one of the reasons why we are also working with the ILO through the Global Coalition to highlight all these great initiatives that are literally working in silos around the world, and just bring them together to help this informal work population.
Thank you, Akran. I have a couple more questions posted. We'll only take the two because we need to keep to time. But Dr. Sashi Chandrasekhar from India asks, what policy changes are required for social security of migrant workers?
When we talk about policy, the first question that I always ask myself, should we look at research to drive policy, or should we draft policy to encourage research? So I answered that question with a question to everybody. There's a lot of good research around that. It's already part of our of our practice, but sometimes the research that we have, it's not implemented into the policies we see, or vice versa. Sometimes we have good policies or not so good policies, and research goes simultaneous another way. So I think that when we talk about informal work, I go back to the last question. The policy has to be driven by the local necessity of informal work. So if you have 90% of your population as informal, then it should be top priority to be included somehow in your social security system. If you have 1% of informality, I'm not saying it's not important, but maybe policy will be shaped different. So so policymakers should be using research to craft these policies, but at the same time, the research has to be implemented tailored to the necessity of each country or each society or even each city. I mean, there's countries who have cities of 25 million. Maybe a certain city has a specific need and should have a more tailored policy within that city. So, there's not a specific answer to your question, although it's a great question, but that's what we wanted.
Hello, Claudia. Can you hear me?
Thank you. Apologies, I'm in and out. My internet is very unstable. Thank you, Akran, for wrapping up so nicely and for answering the questions. And now I'd very much like to introduce Dr. Clive D'Souza. Can everybody hear me?
Yes, Claudina.
Okay, thank you. All right. So Dr. Clive D'Souza, PhD, is graduate faculty of the Department of Rehabilitation Science and Technology at the University of Pittsburgh in the USA. He holds degrees in mechanical and industrial engineering. He's a member of several professional and scientific societies, including the Society of Automotive Engineers International and the International Ergonomics and Human Factors Association, IEA, and he's currently the chair of the IEA Technical Committee on Informal Work. He's also a member of the Institute of Industrial and Systems Engineers and the International Commission on Occupational Health, ICO. His work is widely published and he teaches and supervises students at under and postgraduate levels. Dr. D'Souza has received several awards, and I'm just going to mention some of the more recent ones, which include the University of Michigan Distinguished Diversity Leaders Team Award in 2019, the Arthur M. Wellington Prize for Best Paper Award, the American Society of Civil Engineers in 2021, and the Collingwood Prize for Younger Members, Best Paper Award, American Society of Civil Engineers in 2021. And now it gives me great pleasure to hand the floor to Dr. Clive D'Souza, who's going to talk about bridging informal work and ergonomics, perspectives from the International Ergonomics Association Technical Committee on Informal Work. Thank you, Clive. Please go ahead. Welcome.
Thank you, Claudina, for that kind introduction. And thanks to all of you and to SASOM for having me, for giving me the opportunity to share with you some of the work that we've done, but also some of the information from our technical committee, which I will share with you about very soon. My name's Clive D'Souza, as Claudina mentioned. I am based in the University of Pittsburgh, and my plan for today is to address kind of these three key points. One is I want to segue or follow up from Akran's presentation and discuss again the context of ergonomics, how it relates to the Global Coalition on Informal Work, The International Ergonomics Association, which I will abbreviate as the IEA, is one of the core entities within the GCIW. So as part of that, there are 3 objectives I want to touch upon today. One is introduce our technical committee on informal work. Second, I'll provide some context for ergonomics and informal work as these 2 separate constructs and how they relate to each other. Thirdly, I want to highlight the importance of interdisciplinary collaboration for improving informal worker health and well-being. So I'm a human factors engineer by training. I conduct work in occupational ergonomics as well as in rehabilitation engineering. And that's one of my educational and researcher hat. Alongside, I also serve as chair for the IEA Technical Committee on Informal Work. This is a link to our technical committee. Some of you might be hearing about us for the first time. So what I'd like to do is take a few minutes to tell you a little bit more about our group and encourage you to join, as well as think about how your work might inform what we do. Our technical committee meets on the 3rd Fridays of every month. Coincidentally, today happens to be the 3rd Friday. We were scheduled to meet today, but instead we've taken time to be here at this at your SASOM webinar. I serve as chair, but I also have 4 vice chairs for our technical committee based on different geographical regions. So if you are interested in joining us or being part of our group and you belong to one of these 4 regions, I've listed the name as well as the contact information for our regional vice chairs. We have a vice chair for Latin America, Alen Garagai, vice chair for Asia and Pacific, Professor Mohammed Muzamil from the Aligarh Muslim University, a vice chair for Africa, Augustin Aqua, who's a lecturer at the University of Ghana, and a vice chair for Europe, Maggie Graff. And then I also cover North America, along with help from my esteemed colleague, Akran Salman Navarro, who recently presented to us. Our technical committee has these following aims and objectives. We have set up in 2023, so we've only been around for about 1.5 years. And our main goal is to support the development of the human factors and ergonomics knowledge and capacity in the informal work sector. In the next subsequent slides, I will explain to you a little bit more about what I mean by human factors and ergonomics knowledge and capacity. Our focus is primarily on informal work happening in low and middle income countries, but we must also acknowledge that informal work also occurs in high income countries. The objectives for our group are as follows. 1, we want to support the development of research tools, methods, and interventions adapted to address occupational health risks in the informal sector. 2nd, foster research collaboration between countries to help raise awareness and address issues related to informal work. 3rd, promote and facilitate exchange of human factors and ergonomics practitioners, students, and researchers. And 4th, share research knowledge and experience about human factors and ergonomics in the context of informal work. And we do this through webinars, publications, symposia at international and national conferences. So if you're unfamiliar with this concept of ergonomics, just here's a very brief introduction to it. By ergonomics, we essentially mean the science of work. It's derived from this Greek term ergon, which refers to work, and nomos, meaning science. So it's a science of work. The International Ergonomics Association, which is the largest association devoted to ergonomics in the world. It is a federation. It's a gathering of all federated societies of ergonomics from different countries. In the US, we have the Human Factors and Ergonomics Society. So we are also a member of the IEA by default. The IEA defines ergonomics and human factors. We often use these terms interchangeably as follows. It is a scientific discipline concerned with the understanding of interactions among humans and other elements of a system, and the profession that applies theory, principles, data, and methods to design in order to optimize human well-being and overall system performance. The two key phrases I want to emphasize here, one is interactions occurring in a system. So ergonomics and human factors by default takes a systems approach to understanding work. And second, outcomes. We're focused on both human well-being and safety, as well as system performance. So things like efficiency, throughput, and quality management. There are three main domains to human factors in ergonomics. One is physical. So in the physical domain, you'll often be discussing topics like worker postures, manual material handling, repetitive movements, work-related musculoskeletal disorders, workplace layout and design. A second domain is on the cognitive side. So this is more about mental workload, the cognitive tasks or the mental tasks that occur during work, issues of visual perception, hearing, decision-making, skill acquisition, in applications related to human-computer interaction, human reliability, work stress. So a lot of these topics fall under the cognitive domain of human factors. And then thirdly, we have the organizational aspects. So these involve topics like resource management, work design, teamwork, shift work, participatory design, and community engagement. When we traditionally work in human factors, the bulk of research that has in the past has been devoted to the formal or very organized work sectors. So we have a wealth of research and knowledge about addressing physical ergonomics problems, for example, in manual assembly work, in the manufacturing sector. And there's some examples that I'm going to just briefly show you. In the cognitive realm, a big application for human factors is in healthcare, where you've got a lot of cognitive work, shift work, perceptual and cognitive demands, decision-making, time stress. And so that's one example. Increasingly, we're seeing a lot of cognitive ergonomics research happening at the intersection of human-robot interaction and human supervisory control of more automated systems. Again, a lot of it is in the formalized sector. When it comes to organizational ergonomics, these might be issues of shift work and sleep deprivation, sleep disruption, as well as teamwork. So a classic example might be the Transportation Security Administration's safety checks. Security officers at airports, for example, has been a big focus of organizational issues in human factors and ergonomics. One point I tried to emphasize before was this systems level approach to human factors and ergonomics. A lot of what I described so far can be captured by this one figure. So at the core for human factors and ergonomics are these interactions occurring in a system between the person, as well as the task or the work that they're performing, the tools and technology that they use. And this is one set of interactions that we study. But we're also interested in the environment where this work happens. So the physical environment, the social environment, the organizational, and the policy. And you can think of these as these outer rings that are influencing what's happening inside this core triangle. I described two types of outcomes. One is issues of system performance. You can think of these as the effects that the human worker has on the system. And then health and well-being, the effects that the system or the work or the task has on the human. So this could be health, safety, workplace injuries, accidents, and topics of such nature. So with that background, let's switch gears a little bit and talk about how this relates to informal work. Akran gave a wonderful introduction to this topic, and so I'll touch upon a few key points. The International Labour Organization defines informal work as all economic activity, and this is often excluding any illicit activity by workers or economic units that are not or insufficiently covered by formal arrangements. So informal work is characterized by this lack of or the absence of written contracts, social guarantees, social protections. Globally, we have there's an estimated nearly 2 billion people, more than 61% of all employed people who work in the informal sector. And if you look at this figure more carefully, we see that a lot of the informal work is concentrated in what we call the global south. So this involves Southeast Asia, large parts of Africa, Latin America. So that's one of the key observations from this figure. However, what we also see from this figure is that informal work also is present in many of what we call the high-income countries and very developed countries like Canada, like the US, as well as in Western Europe, Australia. So informal work is present in nearly all countries, but to varying degrees. Other aspects of informal work that relate to us in occupational health and ergonomics are the types of informal jobs that are performed. Informal workers are not one homogeneous set. They're actually a very diverse population. And there is diversity in this group in terms of the occupational type, as well as their social and legal status. So Akran alluded to some of these points in his presentation and touched upon them. This figure, taken from a report by the Rockefeller Foundation, gives you some breakdown of informal work happening in various different sectors. So one of the big employers, or one of the big sectors for informal work, is in agricultural and farm work. Other examples include home-based work. So this is where individuals or groups work from their homes. Construction work also involves a lot of informal work. Domestic workers, in the manufacturing, so small-scale manufacturing, street vendors, transportation workers, so food delivery workers, for example, as well as waste pickers. The key points I want to emphasize here is that we should not think of informal work as a dichotomy or very clearly defined formal versus informal, but informality actually exists on a continuum. Different sectors and different regions of the world, we find different levels of informality, sometimes even embedded within the formal sector. So something like manufacturing, where we have the first and second tier level manufacturers might be very formal, but at the lower rungs, there could be informal groups or informal contributors that are participating to actually source the raw materials and get them to these manufacturing sites. Same thing with construction. The other aspects is that informal work occur at various different scales. It could happen at a large scale in terms of farm workers. They could be happening at an individual level, in individual domestic workers, in somebody's working in somebody's home, self-employed workers, for example, working in small groups, and then as well as these newer forms of work like platform and gig workers. Informal work is often also referred to in some places as this gray economy, because it falls sometimes in these shadows where it is not fully regulated by their national government, and so may not be fully taxed. And as a result, a consequence of that is that their contributions to society may not fully be accounted for, and their contributions may not even be included in the GDP estimates for those countries. So it's important to understand, again, this notion of a informality on a continuum. Another aspect of informality has to do with the proportion of women that work across these different sectors, and that also differs a lot. So these are just a few examples that I've provided, where studies estimate that certain sectors like agricultural workers, women make up more than 40% of the informal work sector. In other sectors like construction, they can be much less. It could be around 10 to 12%. Again, domestic workers and home-based workers have a very high proportion of women informal workers as well. So as I mentioned before, informal workers are without these social protections or social guarantees through their work. So they often don't have the type of sick leave or social or let's say monetary guarantees. Other aspects is that they may not have decent working conditions. So these are examples that I would talk about from a project that we were involved with. And I'll explain this in a little bit later in my presentation about informal e-waste processing in the country of Ghana. Related to these issues of informal work also are the psychosocial factors and worker vulnerability in the informal sector. There are lots of gender inequalities, like I mentioned before, stigmatization, and Akron beautifully captured this in his phrasing of these as 4D jobs, with the fourth D referring to discrimination. Because of the lack of regulation within the informal sector, one negative consequence of this is this issue of work intensification. Because the job pays less, because it's unstructured, because workers can perform these jobs in some sense at different times, in different times of the day, or to different levels, they tend to perform more of these jobs in order to make up for that low income. So there's this notion of work intensification. Oftentimes, informal workers might have 2 or 3 jobs. Even over here in the city of Pittsburgh, where I am based, we might have, for example, Uber drivers who might be driving straight through the night and early mornings. And then during the daytime, they might be students at the university. And the evenings, they might be performing some food delivery work, catching a few hours of sleep, and then going back to their driving their vehicles for these ride-sharing companies. Right? So there's this intensification that occurs because of this lack of regulation, and it's not a pure 9-to-5 kind of job. This also opens up these workers to the risk of exploitation in many forms, again, as a way to extract as much work from them as possible because of these unorganized, unstructured work settings. So just to recap, some characteristics of informal work. Informal work studies have shown that workers tend to be poorer and more vulnerable than formal workers. More than a third earn less than $1.25 a day on their jobs. They are exposed to higher rates of occupational hazards. This could include physical, chemical, and environmental. There are higher rates of job insecurity and high psychosocial stress. They have unhealthy, unsafe working conditions, higher rates of injury and illness, excessive hours and no sick time. Again, that concept of work intensification, inadequate access to healthcare and social protections, and then increased risk of discrimination, violence, and exploitation. To help, again, increase awareness for some of these issues of informal work, through our IEA Technical Committee on Informal Work, we've been organizing webinars. We've only been around for a year and a half and been organizing webinars in the last year. Since July 2024, we've organized 6 different webinars with the main focus of increasing awareness and exposure about informal work issues in regions of the world where often some of these jobs may otherwise be unknown or invisible or maybe sometimes unrecognized. What I'm showing you are a listing of the 6 webinars that we've performed. All of these are available on our YouTube channel. So you can just do a quick search on YouTube for IEA Informal Work, and you should see in the results a link to our playlist where you can see all of these 6 recordings. We generally have about 2 to 3 presenters per webinar talking about different topics related to informal work from different regions of the world. These get an audience of anywhere between 15 to 50 attendees, so they tend to be a little smaller than today's webinar. But the nice thing is, because there are recordings, we can always view them later. And to date, we have close to actually 600 views of these recordings in total. Interestingly, we've made a concerted effort to increase geographical diversity in our webinars. We have had 16 different presenters in these 6 webinars from 13 different countries. 4 of these 6 webinars, the ones I've highlighted in red, were actually conducted in languages other than English. So these would either be Spanish or Portuguese. And we often have either live interpreters or closed captioning in English to support our audience that otherwise may not know some of these languages. So some examples include informal work happening in Chile, in Argentina with regards to food delivery workers, in Bolivia, in these small-scale industries, in Brazil, in Ecuador, where we had studies presented about street vendors, in Chile, in Switzerland, and Germany. So informal work covering in Europe, where our presenter on Germany talked about sex workers in Germany that fall under this category of informal work, and then informal work in Colombia with coffee producers, as well as in Peru with street vendors. So these are just some examples of the topics we've covered. And here's just a quick screenshot from one of our webinars where we had presenters from countries in Latin America, as well as language interpreters supporting the webinar. I'd like to switch gears a little bit and talk about just the third objective of my presentation today, and that has to do with interdisciplinarity in addressing the health and well-being of informal workers. And I want to use some examples from a project that I was involved with a few years back related to informal work, e-waste work at Agoploshi in Ghana. I want to acknowledge some of my collaborators that helped me on this work and actually got me involved in this work. My collaborator, Augustin Aqua at the University of Ghana. Some of the work I'm presenting to you actually was Augustin's PhD dissertation. And some of us ergonomists were invited to be part of his research team. And that includes my colleague at the time when I worked at the University of Michigan, Professor Bernard Martin, who's a occupational ergonomist and biomechanist. And then Professor Julius Phobel, who is the Dean of the School of Public Health at the University of Ghana in Accra, who was also Akran's PhD advisor at the time. And Professor Julius Phobel brought an experience from other aspects of occupational health, including chemical exposures and toxicity. And that was his kind of area of expertise to complement our skills in physical ergonomics. I want to acknowledge some of the collaborators. So a lot of this work that I'm presenting you now was based under the GeoHealth Network. This was a collaboration between the University of Ghana, other West African countries, as well as the University of Michigan and McGill University. And this was through a very specific program through the US National Institutes of Health that focused on international collaborations. This work had collaborators from the School of Public Health at Michigan, as well as the Center for Ergonomics and the University of Ghana. So just to set the context for electronic waste, what we generally term as e-waste. A record 62 billion kilograms of e-waste was produced globally in 2022, compared to 34 billion in 2021. So we are seeing this very exponential kind of increase in the amount of electronic waste that is being generated across the country year after year. The problem is that only about 22% of this global electronic and electrical waste is formally collected and processed, while the rest of it gets often shipped out to other countries where they've got very lax or minimal regulations, and they get shipped to these countries that often tend to be low and middle income countries for recycling. And this figure from a global report just gives you an idea of how this e-waste often flows across these international boundaries. And many of these arrows end up getting pointed to indicating where e-waste is flowing to, end up being in Latin America, in Africa, in Southeast Asia. Agoploshi, Ghana, a few years back, was one of these largest informal e-waste sites in the world. Large quantities of these end-of-life electronics would make their way into this country, Sometimes they would be from other countries in Africa, sometimes from countries in Asia, in Europe and in North America, in the form of donations, which would otherwise be electronics that do not work. They would end up at this large site, and I've kind of indicated it over here on this map, called Agbogbloshie. A lot of this electronic waste was processed by low-skilled, low-wage workers as a means of livelihood, and they would use these very rudimentary work methods and hand tools. So imagine trying to dismantle an entire refrigerator or a engine block using just a hammer and chisel, right? And the intent here was to extract out some of these components that would otherwise could be resold for income. So this could be things like certain semiconductors, or the copper from copper wires by burning off the insulation, and then they would sell that copper to these other collectors who would then use it and resell it to other places in the market. So the processing and recycling of e-waste in a lot of countries, again, I'm just using one example of Agbogbloshie in Ghana, is often conducted by low-skilled workers in the informal sector. There's just some examples of the work conditions that these workers are exposed to, right? So again, very rudimentary tools, no proper workstations, no proper protective equipment, even if it means gloves or masks. And they're often working on at floor level in these awkward postures, highly repetitive motions. So any ergonomist looking at this would can kind of readily see some of the many negative kind of, or the adverse health effects that might arise from some of these unhealthy work conditions. There's a lack of access to proper protective equipment, but also a general lack of awareness of some of the occupational safety and health practices. I mentioned earlier about this extraction of copper from copper wire, and they would do this by the open burning of these insulated copper wire. So then again, that releases all of these chemicals and toxins into the environment, into the air, some into the ground, which then makes its way into the nearby communities, either directly or indirectly through soil contamination and contamination of water sources, as well as food supply. To understand what's happening at Agbogbloshie, we must also understand the broader context that nearly 83% of employment in some of these African countries, right, can be informal. And so due to the lack of other formal employment opportunities, many of these workers, often they tend to be migrant workers from other parts of the country or from other countries that get, I think, attracted or drawn to some of these types of jobs because it, again, is low skilled. It has a lower bar for an entry. And as long as they can get their access to some of these work sites, they're able to perform these tasks and actually get some type of income. So as part of our research efforts, one of the things that Augustine was, the effort that he was leading for his work was to try and detail the processes involved, to understand really what is happening within these informal, unstructured work settings, as well as understand and quantify the associated occupational and environmental health challenges. And this was a multi-method approach that involved multiple years. It involved field observations, worker interviews, dialogues with stakeholders, as well as some empirical studies. So I want to highlight some key findings from this work. One is that even though it was an informal sector or informal work population, there were thousands of these workers, there was some informal hierarchy happening within that, right? So it's important to understand, again, these are not just one homogeneous set. Even within this, there's some informal hierarchy. There were three main categories that were identified. One was e-waste collectors, to go about gathering all of this e-waste and bringing them to a centralized location. Dismantlers, these were workers that were mostly tasked or at least responsible for dismantling and taking apart these large assemblies into their constituent components. And a third group that involved e-waste, what we call e-waste burners. And they would perform these tasks of burning to, again, extract out the constituent minerals, precious metals, copper, silver, and then selling those to some of the local buyers. Another aspect of this was big, and it was somewhat unique to the location that we were here, is that there were a lot of different, because these were different migrants, and in Ghana, there were also different ethnic tribes. So there were some tribal hierarchies, there were tribal chiefs, and even to conduct research in a place like this, you had to go through and somewhat give a presentation and get buy-in from the local tribal chiefs before you could actually go and talk to the workers, right? There's a hierarchy in terms of kinship. There'll be often young children, teenagers, that would often be handed off to their uncles or some senior member in their family to help them learn and on the job and to get trained, almost like an informal apprenticeship, and then gradually develop their skills and then become an independent worker. So there's these different socio-technical aspects to understand even within this informal, unstructured work setting. Just some very key, quick recap of some key findings that we found in terms of physical exposures. So one was high prevalence of burns, cuts, lacerations, scars from injuries, exposures to non-neutral postures. You can see these kinds of extreme bending, forceful exertions, high repetition rates, contact stresses, vibration, working in outdoor extreme hot weather conditions, uneven roads when pulling these kinds of loaded carts, and a lack of access to personal protective equipment or any kind of safety gear. We've reported in many different publications the prevalence of work-related musculoskeletal disorders in these populations. So again, focusing primarily from an ergonomics perspective, and again, the high prevalence of low back injuries, issues affecting the knee, the lower extremities, the shoulder, the arm. And in some of these studies, we even had control groups. So these were non-e-waste workers from other suburban areas that distant from this place. And we could, again, make comparisons between the e-waste population and these control groups, demonstrating a high prevalence associated with informal e-waste processing. I will not talk about all of these details, just to give you a sense of the types of findings that we found. And many of these are in the published literature. More broadly, beyond the physical ergonomics, there were also other occupational and environmental exposures that are important to note. One was pollution from burning of insulated copper wires, release of particulate matter, which also affects cardiopulmonary function, release of toxic metals like lead, cadmium, zinc. Studies conducted by other members of our team, led by Professor Julius Phobel, found high heavy metals in blood and urine samples of workers, as well as in the soil. So there was soil contamination at the site, noise-induced hearing loss, and then just a lack of education about health effects of the work that these workers were actually performing, and how to go about doing them more safely. So just some examples of these environmental exposures. So these were like fine particulate matter, these PM 2.5 levels, and these were almost 2 to 3 or 4 times higher among e-waste workers compared to controls from suburban areas, as well as these particulate matter exposures differed based on the tasks that they performed, as you might imagine. So burners, people that perform tasks of these open pit burning, were found to have higher exposure to these small particulate matter than other tasks like sorting, loading, and dismantling. There was also decreased pulmonary function among these workers, both, I think, at baseline, as well as 6 months and then 12 months in these longitudinal assessments. So a lot of these findings have been published in publications by other members of our team. The e-waste site at Agbogbloshie, Ghana has received a lot of media attention. Besides research studies, there have been a lot of global reports, including by Greenpeace, talking about contamination at the site. More recent efforts have focused on these notions of circular economy, again, how we might manage e-waste better and introduce better legislation to prevent trans-border flow of electronic waste. But the key takeaway message, at least for us from these studies, was that e-waste and e-waste management and processing presents a major global health challenge in the 21st century. I'll talk about interventions in a short bit related to informal work to try to tie these topics together. But just fast forwarding a bit more recently, this was in 2021, because of all this negative news exposure and the bad reputation, as well as the health consequences, the government of Agbogbloshie very quickly decided to demolish this site. None of the workers or the tribal leaders or any of the researchers, the community organizations, the nonprofits working in the area, none of them were taken into confidence, and they were all, in a sense, caught by surprise. This is just showing I'm showing on the image on the left and the right, images taken before and after the demolition. So on July 1st, 2021, with large kind of demolition teams, as well as with the military, and again, this is reported in the news media a lot, and the entire site was demolished, right? And so this notion of out of sight, out of mind, right? But has the problem really gone away? Many publications subsequent to that talk about how there was a great disservice done to these informal workers. Alongside the environmental and health challenges, there was also a lot of good things happening in terms of the creativity of the workers, the entrepreneurship, and the efforts in terms of safety and health and education being done by community-based organizations. And in a sense, overnight, all of that work was just also dismantled and demolished along with the e-waste site. What ended up happening was that a lot of these e-waste workers and these tasks got pushed into the shadows, into the suburbs, and became more distributed. So where previously it was more centralized and localized, now it has become, in a sense, a much more difficult problem to manage because it is all spread out into the nearby neighborhoods and communities. And so e-waste processing still does happen, but it's hard to quantify now, it's hard to manage, and it's hard to reach these workers because of these very drastic actions that were taken. And then very recently, highlighted in yellow here, this is an article just from this year, and I've highlighted the red box at the very bottom, where there are more recent reports indicating that e-waste work has resumed at this demolished site. And so they've kind of, workers have started to come back here. Now, whether it will happen at the same scale, whether there'll be improvements, that's yet to be seen. But this idea that these workers were totally disenfranchised, they were totally kind of discriminated against. This was viewed as a complete like a nuisance or a problem that you had to get rid of, as opposed to being more creative and actually getting buy-in from the local stakeholders and workers to come up with a very creative solution, right? So that brings me to my towards the closing of my presentation. I want to talk a little bit about interventions. I know many of the questions directed to Akran were also about interventions. When we think about human factors in ergonomics and this socio-technical systems perspective, so that figure that I'd shown with all the many rings that influence human factors in ergonomics and worker health and safety, we can think of interventions as happening at many different levels. These are not all mutually exclusive, but I've tried to group them into 4 kind of broad categories. And you can think of these as interventions that might happen at the population level or at the individual worker level, right? So at what point are you intervening into the system? There is no magic silver bullet. I don't think any one of these would only be the solution. I think we need a combination of these, right? So just very briefly, walking through these 4 levels of interventions. At the international level, examples might include occupational health and safety regulatory officials, international NGOs, policymakers, examples might include the International Labour Organization, United Nations, World Health Organization, right? So and the World Bank, the OECD, these are all examples of international bodies that could have a positive effect on informal work. Based on my review, there seems like there are two broad approaches to this. Some organizations take the approach of formalization, viewing formalizing these sectors as a solution to informality, right? So that's kind of one approach. Again, I'm not advocating for one or the other. This is just what I've encountered in my reading. Second, some organizations take a very rights-based approach. So examples might involve human rights. So the United Nations human rights documents. There might be certain agencies that work on rights of workers. So the International Labour Organization's decent work agenda would be an example of that. There are some that relate to the environmental rights. So things like the United Nations Basel Convention that had to do with the shipment, the trans-border shipment of informal work across borders to low and middle income countries and trying to ban that, right? And so there are some, these are kind of efforts that could be happening at a very international level. Next, you could have national and state level interventions. These might involve governments, law and policymakers in a country or at a state, local regulators and NGOs. So some examples might include universal healthcare, right? So informal work happens, but these workers don't have any health protections or health services. So universal healthcare, which allows any and all individuals or workers, for example, to guarantee them some form of access, is one solution to addressing some of these health and safety concerns. It is reactive, first. Second, it also requires these governments to put effort into these primary care centers so that they have the right training to address occupational health concerns, which is often a gap. Some examples based from our collaborators in India that have listed some initiatives taken by the government of India to address informal work. One is this, a couple of years back, they instituted this eShram, like a web portal. And the idea here was to develop a national database of unorganized workers. So having workers register onto this site, even if they're single person businesses, informal workers, unorganized workers, waste pickers. So they could all register at the site. And by registering, it allows them to avail of welfare benefits. Again, I do not know how effective this has been, but these are just national level initiatives that have been instituted. And then this second initiative, which had to do with registering for digital health services. Another notion that has been floated, and it's been successful in some places, is this idea of social contracts. So because there is no proper employer to sign a worker contract, the state or some local entity takes on that role, and it signs these social contracts with the workers, defining rights and obligations. A third level of interventions could happen at the educational level. This could be education at universities, vocational education centers, or even education that is happening at the community level with help from community-based organizations. This could be things like health and safety training, proper use of protective equipment, or something more formal like educational research centers, funding for international collaborations, like I was demonstrating with this e-waste work in Ghana, as well as programs either from governments or from foundations that support student exchange, so that there is a cross-disciplinary understanding of these issues and building capacity in countries that otherwise don't have local research capacity. And then third, lastly, at the practice or at the lowest level, which is at the worker level. If this were an informal sector, if this was a formal sector, we'd be talking about company CEOs and HR managers. But in the informal sector, we don't have that, right? So it's more about working directly with practitioners, with the workers themselves, with worker contractors, and the designers of these work and work systems. So at the practice level, we are talking more about a bottom-up, grassroots, small kind of tailored interventions. And the advantage of this is it can be tailored to very specific vulnerabilities of that specific work population. So whether it's e-waste workers in Ghana, or whether it is waste pickers in a place within a city in India, right? And one initiative within this practice level is helping workers organize. So I know some of our subsequent speakers will be addressing these topics about how they've worked through with grassroots workers and organizations to unionize, to form associations. And I know Vigo has done a lot with women workers, informal workers around the world. From an ergonomics perspective, this might mean working in a participatory way with these workers to redesign the work equipment or the technology. But then we also want to understand those informal hierarchies that I was mentioning before, like ethnic tribes, the importance of kinships in these kind of workplaces, as well as their knowledge, their experience, and leveraging that to come up with effective interventions at this level, along with getting these workers to buy into these interventions. So again, not one single magic silver bullet, but almost interventions that occur at this continuum. So that's all that I have in my presentation. This is my contact information. And I'd like to conclude with, again, making a small pitch for our IEA Technical Committee on Informal Work. We meet third Fridays every month on Zoom. If you're interested in joining us, you're welcome to contact me by email or any one of our regional vice chairs. With that, I will end. Thank you for this opportunity to share our work with you. And I'd like to take any questions if we have any time.
It looks unfortunately as if we've lost Claudina, but I can see a few comments here in the Q&A. A Dr. Damador Lele, any positive ergonomic intervention carried out? Please, can you give examples? How do we overcome resistance from owners, business managers for making these changes?
So I think there's lots of, hopefully one takeaway from my presentation was that a lot of complexities working in the informal sector. So it's important that we get buy-in from these whether they're managers, whether they're local supervisors, or from the workers themselves. One example I like to give that's been documented in the literature has to, again, it's a bit of a negative example, but with these e-waste workers in Ghana, there was a push to introduce these, like a large wire stripping machine. So instead of, to get rid of the open pit burning of these insulated wires, they brought in a large wire stripping machine. Couple of problems with that. One, it was only at one location. So the workers had to move all the way to that one location to actually use that machine. And there would often be a big waiting time, right? So it got rid of the burning problem, but it introduced new problems in the process. Workers found this very disruptive. Every minute that you were away from your work, waiting in line was a risk to your daily income, right? So that was a key kind of reality that had to be understood. Second, the workers, again, this was a perception among them because, again, it could be because of a lack of an education component to this intervention. They perceived that using wire stripping machines would reduce the yield of copper compared to if they were just burning the insulation. Because there was the risk that along with the insulation, there would be even like a fine amount of copper that was getting, in a sense, wasted, which they otherwise could have gotten if they had just burned these in an open pit. And so as a result, people began to abandon this wire stripping machine and opted back again for open pit burning. Right. So this was a very positive intervention in terms of addressing one problem of toxins and chemical exposures, but it introduced other unanticipated consequences, right? And so this is just one example where there are interventions possible, but we need to understand the full context of where that work is happening, as well as what these workers' concerns are, right? So whether it has to do with income, whether it has to do with waiting times and disruptions to their workflow. So with proper education, with proper incentives, again, there were at least some of these burners that went back to using this wire stripping machine, but not all of them, right? So this is just kind of one example. Again, there were some positive aspects to it, but also negative. But again, these interventions need to be thought of as multifaceted, right? There need to be different components to it, both in terms of like a education, intervention, but also understanding the economic implications of this for their work. So I know that does not answer your context fully, but the better we are trained to understand how to design interventions, and I would put this under the bracket of implementation science. What are the facilitators? What are the enablers? So we can have, while we have good interventions, understanding the implications and unanticipated kind of consequences of this, trying to study those, the more effective our interventions will actually be. So I hope.
Yeah, no, that's fab. Thanks, Clive. In linking with interventions, actually, I've got a comment here from I'm assuming it's a Dr. Mokoatle. It says, as long as many of these low middle income countries are not free or not financially self-sustaining, health outcomes negatively related to informal work will persist for many years to come. It may not sound palatable, but it is the truth, if the truth. So that's merely a comment, but also linked to the intervention kind of thing. Any comment on that, Clive?
Sure. So I agree with you wholeheartedly that, and I think Akran mentioned this as well, we don't think informal work is going to go away, right? It's going to exist for many years to come in many different forms, particularly with the new gig economy, the shared economy, platform work, but also in these kind of low resource, low income settings. Which is why I think with many of these organizations internationally, there is a focus solely on just formalizing the informal sector, right? And we don't, at least I don't think that is a long-term, like a viable solution, right? It makes sense in some domains, in some sectors to formalize, but it may not be very effective or meaningful in other places, right? So really understanding what situations are actually amenable or appropriate for formalization and which ones are not, right? And so that's why when I focus on my interventions, I'm talking about these different levels. Formalization could be happening at international and national levels, but not everywhere. Hence, we must also focus on these education, on these practical practice or practitioner level interventions with workers, with community organizations, with nonprofit organizations. And the other part is if you're in academia, even helping our students understand how much of work that occurs outside is in the informal sector. I don't think we fully train our students to address that, right? Because we often focus on the big companies, the formal sectors, the manufacturing, the big healthcare facilities, but not so much the informal. So I wholeheartedly agree with you. The question is interventions, right? We must make sure that we are following at all these levels and not just fixated on formalization.
Brilliant. Thank you, Clive. I know we're a bit over time. There's two more comments or questions. A quick one from Dr. Kazana. Is there any effort to hold any webinars in Africa?
Could you please repeat that? I missed it.
Is there any effort to hold more webinars in Africa?
Oh, webinars. Yes, yeah. we are looking for more presenters from Africa. We are trying to line up a couple of presenters. Again, my colleague Augustine at Ghana is helping me on this. We would like to have more presenters. just given the amount of informal work that happens in different countries in Africa. So if you're interested, please reach out to us. We have a lot of slots. We try to hold at least one webinar every other month. So as you imagine, we have lots of openings. If you have interesting work to share, whether it's assessment, exposure assessment, or whether it's interventions, all of it, we are interested. So yes, please reach out to us.
That's great. Thank you, Clive.
Thank you.
Also to everybody online, if they want to get in touch, we will share the presentation with everybody on YouTube as well as the link afterwards. But if you want to get involved with any of, or get in touch with any of our presenters, please just give me an email on office@sasom.org and we can make the necessary connections. I know we're running a bit behind time. So thank you very much, Clive, for that insightful presentation. We really appreciate our international presenters stepping up to the podium and giving us and sharing all their knowledge, actually, not giving us their knowledge, but sharing their insight and knowledge. We are scheduled to have a break until 4:10. So what I will suggest is we come back at 4:10 when I will hand over to Dr. Kotze, who will be chairing our second session, and then we will introduce our presenters as well. I apologize. So yes, 4:10. Thank you, everyone. And then the slides will be available. Yes, I know the slides or the presentations are always very large in size when it comes to digital format, etc., but we can make it available in PDF format, of course. I will liaise with our presenters and also share it with those that attended today on the live session. Yes, so we see everybody at 4:10 for our second session. Thank you very much. Informal and migrant workers. I will be introducing Dr. André Kotze soon to be chairing our second session. The program is in front of you, which he will also introduce you to. I've shared a link, which I will also put in the chat, which is our YouTube live link. This session is also being published live on YouTube, and then also for reference afterwards, you are more than welcome to go and rewatch it there. I just want to make a quick notice in terms of the CPD certificates, make use of this opportunity to just let you know about the CPD certificates. All SASOM members, it's free of charge to you, and it will be issued over the next few days to any delegates who've attended today. The HPCSA SAMA accredited CPDs are 4 clinical unit points at level 1, and I will be sending those off straight to the HPCSA to those members or to those individuals who are members of the HPCSA. Others will be receiving their certificates from the office in due course. Non-members, you're welcome to attend today for free. However, if you do wish to have a CPD certificate for wherever you are in the world, we will be charging a small admin fee, which is the equivalent of about $5.6. Just email me with the relevant subject line of CPD certificates for webinar 1, and I will be issuing you with that. If you're an HPCSA member, I will be issuing you your certificate via an invoice. Dr. Kotze, over to you.
Dr. Kotze is still muted.
Excuse me, everybody. I'll restart. I'm Dr. Andre Kotz. I'm the Vice Chair of SASOM. And our session 2, Exposure to Occupational Heat Stress in the Informal Sector, this afternoon. And the first presentation is by Professor Rajan Naidu, is on the health effects of occupational heat exposure amongst informal workers, the South African perspective. I just want to quickly do a short introduction. If we are looking at Professor Naidu, we are looking at, he's the head of Discipline, Occupational and Environmental Health, University of KwaZulu-Natal, Durban, in South Africa, and has over 30 years of professional history in the field of occupational health in South and Southern Africa, and is widely published. He holds undergraduate and postgraduate qualifications in medicine, occupational health, public health, and industrial health. He's an associate of the College of Public Health Medicine, the Division of Occupational Medicine in South Africa. Now, Professor Naidu is affiliated with professional organizations, including the South African Society of Occupational Medicine, SASOM, the South African Thoracic Society, the International Society of Environmental Epidemiology, the European Respiratory Society, and the International Commission on Occupational Health, ICO. His work is focused on occupational respiratory diseases in various work settings. He has served on national and international policy structures in this field and has provided leadership in South Africa on mine-related occupational diseases. He serves on the structures of trusts that are responsible for the compensation of mine workers suffering from occupational diseases. I welcome Professor Rajan Naidu.
Thank you, Chair, and thank you for that introduction. And I'd like to say, let me start my sharing. I'd like to say a very big thank you to SASOM, both for the invitation as well as for using this opportunity to profile the challenges faced by informal workers. And I think this is the presentations by our colleagues Clive and Akran placed the challenges that informal workers face in a very good global context, and for us to realize that the problem is a big one even for ourselves in South Africa. And some of the issues they raised about how we as occupational health professionals rise to those challenges are quite important for us to understand. So these talks that we're having today provide us with an opportunity to try to better understand these. I'm hoping that you can see my slides in presentation mode.
Perfect. Thank you, Roger.
So,
Looks good.
thank you very much. Thanks. So both Akran and Clive gave us a broad overview of the sector of informal workers. I'm going to speak specifically on heat exposure and heat stress. And I think the talk that will follow by Sonal, and once again, I must also say a very big thank you to colleagues from WIGO and colleagues from SEWA for making themselves available at relatively short notice to use this platform to talk about the work among informal workers. But Sonal's work is going to sort of provide us with the much broader social context that these workers face. Okay, so slides are not changing. There we are. So I think more and more globally, we're becoming aware that workers are facing a major crisis in terms of heat exposure and the impacts on their health as a result of this. So these are some of the headline grabbing stuff that we see from organizations like the International Labour Organization and the World Health Organization. More recently, earlier this year, over 86 health organizations provided a input to the Occupational Safety and Health Administration in the US, talking about how the urgent need to address the standards related to heat. And some of the information they provided was that there were 34,000 heat-related injuries occurring in the US between 2011 and 2022. And I think that, to my mind, sounds like a considerable underestimate. But in terms of the costs, $1 billion in healthcare costs every year in the US. But these newspaper headlines also reach us in South Africa. So this is what we saw sometime in the course of last year. 8 workers die as a result of exposure to heat. The challenge for us is that this became big news at that point in time, but we very quickly tend to forget and we move on to the next item. So that's the one concern, is how quickly we forget. But the second more important thing is that we then tend to focus maybe on deaths as opposed to what is going on an everyday basis among workers in South Africa. And that's the sort of emphasis I want to take with this talk. We've already heard these figures. 2 billion workers employed in the informal sector. In South Africa, it's approximately 3.2 million workers are in the informal sector. And as Akran pointed out, they make a considerable contribution to the GDP. In South Africa alone, it's 28%, 160 billion rand annually in absolute rand terms. So these workers are contributing to our economy. And the question is, how does that society which benefits from this invest into the workers in this sector? And these are sorts of numbers over the years. And as you can see, both in terms of absolute and in terms of percentage of all workers employed, there's been a increase over the last 10 to 15 years with the numbers of workers in the informal sector, currently sitting around between 3 to 3.2 million workers in this sector. In terms of climate change, we know almost all of these workers are likely to be exposed in some form or the other, either at work due to heat or in some instances due to other extreme weather events such as flooding and other disasters. And our colleagues in WeGo, Laura Alphas and Christy Ibrahim, have pointed out that more than 2.4 billion workers worldwide are exposed to extreme heat annually. There's just some data on why it is a problem in Africa and particularly Southern Africa. So we all know the IPCC, the Conference of Parties, who have this annual get-togethers, talk about the attempt to keep it at 1.5 degree change, and we hope we don't go above 2. All very nice talk, but doesn't quite apply to Africa. So however we look at it, Africa is experiencing the brunt of the climate change. So already we've seen Africa being hotter over the last couple of decades than the changes that have been seen in the rest of the world. So if we look at the current 3 scenarios that the Intergovernmental Panel on Climate Change puts forward, the 1.5, the 2, and the 3 degree change. If we work according to that, the African continent will experience a 1.2 at the best case, a 2.3 and a 3.3 degree increase. So that means Africa is getting hotter than the averages that are posted for globally. And this then presents us with a particular challenge here when we're thinking about the exposures of workers. So in terms of heat waves, we're likely to see 3 to 4 more heat waves compared to the children born in 1960. And this is going to vary geographically. So in Angola, for example, this is going to be 7 to 8 times. In 2019, 475 million additional heat wave events were experienced globally, and a 53.7% increase in heat-related mortality among elder folk globally. But let's turn to work itself, and let's look at Africa. So it is estimated, and this comes from the very good publication from the International Labour Organization on heat at work. It's estimated that almost 93% of Africa's workforce is exposed to excessive heat. And in terms of injuries attributable to excessive heat, almost 7.2% of all occupational injuries were heat related. But the other important factor that we've got to consider in this paradigm of heat, while the headlines tend to grab us around heat waves, this report from the ILO is particularly telling in that in terms of exposures to excessive heat, 90% of these occur outside a heat wave. So while we all go up in arms when there's a heat wave, more of the workers are being exposed outside heat waves. And 80% of the injuries that are attributable to heat occur outside of a heat wave. So just monitoring what is going on in terms of heat waves is not adequate if we want to protect the health of workers. So if you look at, once again, we're saying heat waves here in this comment from the ILO. In 2020, 231 million workers were exposed to excessive heat, a 66% increase from 20 years ago. It's estimated that by 2030, heat stress will reduce total working hours to the point of costing 2,400 billion US dollars, a productivity loss equivalent to 80 million full-time jobs. So a substantial impact on the life of work. We have seen over the last 5 to 8 years or so, there's been an increase in the research work conducted by colleagues across the African continent, some of them mentioned by Clive, particularly in West Africa. But I think this has been very important that the attention is shifting and we're starting to pay attention to how workers are exposed. I'm not going to try to present in this talk the results from all of these studies, just to say a large number of these studies are showing very significant and substantial effects associated with heat exposure. Let's turn to understanding heat stress. So I think these are some of the things that we need to, the concepts that we need to understand in occupational medicine. I spoke just now about heat exposure. Heat stress is basically what occurs biologically. So it's a state in which excess heat is stored in a worker's body, which if not released to the environment will raise core body temperature, leading to the health risks, which we'll speak about just now. And a number of different agencies, particularly the ACGIH in the US and also NIOSH, have put forward some sort of standards that one needs to measure, because you can't always measure heat stress on a day-to-day basis, but you have an understanding of what the environmental exposure is, what the types of work that people are doing, and how this is likely to cause heat stress within an individual worker. And so, if I can get my pointer up. So if we look here, it's categorized according to light work, medium work, heavy work, and very heavy work. And they make use of the wet bulb temperature to give us an indication of what a worker may be exposed to. So if you're working at a temperature of 28 degrees and doing medium work, let's look at 27 degrees is basically the cut point for doing heavy work, and 25 degrees for very heavy work. Now, 25 degrees may seem low, but this is the temperature that we would experience in Durban around this time in June, July. So this is the winter temperature in Durban. And so if you're working at doing very heavy work, then you start to get into this heat stress situation. So if you go up 1 degree, 26.5 degrees, you're expecting the worker to rest for 25% of every hour. And that's how you interpret this table. So if we're looking at informal work, most of whom will fall into the categories 3 or 4, the amount of time they would spend at different temperatures. If you're looking at peak summer temperatures in a place like Durban, right, the worker needs to rest for 50% of the working time. So you can imagine the impact this will have on productivity. And how does this occur? So essentially, the body responds to heat in 2 critical ways. Firstly, you get vasodilatation. So there's attempts at controlling core temperature through release of heat through the skin. So vasodilatation to the vessels at the skin. And then you have increased sweating. So the vasodilatation then starts to have an impact on your cardiac function, increased cardiac output, and causing stress to the functioning of the heart, and then the sweating resulting in dehydration. And then this gives rise to these acute and effects, which can be both mild or severe. And these are listed here. Now, the other point that I want to make in this talk is that while we tend to focus on these acute effects, mostly heat exhaustion, heat stroke, and death, what's very important and what tends to be forgotten is the chronic effects that we see. And to a large extent, we don't see these because we don't look for them. So, the 8 workers that died in the Northwest Province last year, for every one of those 8 workers, there's probably 100 or so more who are having some form of undiagnosed heat-related disease. But conditions like cardiac disorders, respiratory disorders, chronic kidney disease are not looked for. So because we're not looking for these, we are not making the association with heat outcomes. But there's been substantial work done now, particularly with chronic kidney disease and also adverse pregnancy outcomes, which have shown both among formal and informal workers to be substantially associated with heat exposure. And with pregnancy outcomes, we're seeing effects as high as a 2-fold increase in adverse pregnancy outcomes, such as low birth weight among informal workers, particularly among the work done in India, among informal pregnant females are working in these hot conditions. So this is some additional data that is come through from the ILO as well. So in 2020, excessive heat was linked to an estimated 23 million non-fatal occupational injuries and almost 20,000 deaths. So in 1 year alone, we had almost 20,000 deaths associated with heat exposure and 2.1 million disability adjusted life years worldwide. If we look just in Africa alone, 7.5 million injuries associated with excessive heat in 2020. The point that I'm repeatedly making is that we should not only be focused on heat waves. And so there were 2 out of 10 injuries, 20% of injuries attributable to excessive heat occurred during heat wave periods. That means 80% of occupational injuries linked to excessive heat occurred outside heat waves. So if we don't look outside these sort of extreme weather events, we're going to miss these. Total occupational heat-related injuries. And I've highlighted Africa here. Once again, this is data from the ILO document that I spoke about. And as you can see here, the attributable fraction in 2020 for fatal injuries for a country like South Africa is up to 5%. So clearly, and of course, these sorts of statistics do not reach, for example, the compensation fund. It is not reaching our official statistics. And that's a cause of concern as well. Workers at greatest risk for heat-related adverse outcomes are migrant and informal workers, women and pregnant workers, older adults, workers with disability and pre-existing chronic conditions. Now, what's very important in this is that all of these categories of workers are workers that are found mostly in the informal sector. The formal sector, pregnant women have the opportunity to step out of the working environment. This is not the case in the informal sector. Sorry, the slides are not changing again. Okay, yeah. So why informal sector? Workers at greatest risk. They're more likely to be employed in physically demanding outdoor jobs. They're mostly working in construction and agriculture. Because of the way the work is organized, as pointed out both by Akran and by Clive, they tend to take fewer breaks, working at higher work intensity. Their clothing is often not adapted. They don't have adequate training, and they're most frequently employed in manual labor roles. So the next few slides are just basically to illustrate this. Some of these, some pictures have already been shown by Clive and Akran, but this is just to show workers, informal workers. These are not my pictures. I've shown the credits here, but they to illustrate how intense the work is and how likely it is to be in hot working conditions. And as you can see, most of these informal workers are women, and that's because of the particular types of sectors. These two slides are the work of informal workers around the Football World Cup in Qatar. And we know there's some reports that up to 4,000 to 6,000 of these workers demised as a result of the work that they were doing. And most of these workers, informal and migrant, and most of that migrant workers returned home are now either living with chronic diseases as a result of heat exposure, or they're completely dependent on those poorer countries from which they came. And so this becomes a challenge and a concern for us. The silent epidemics, as I said, we focused on the high-profile newspaper headlines grabbing stuff like deaths in a heat wave, but we forget the silent epidemics. And chronic disease amongst informal workers is rising. So in 2020, there was an estimated 26 million people living with chronic kidney disease attributable to heat stress worldwide. In Africa alone, an estimated 2 million. And almost every one of these are in the informal sector. So this is some work that we've done in Eswatini, and hopefully this video will work. This shows you this worker and the intensity of the work that they're doing. So for about 5 hours every day, this is what the worker does. Because of the heat, they start work at about 5, 6 o'clock in the morning, and they finished off by about 1 o'clock. And as you can see,
Oh dear, it looks like we've lost Prof. Naidu. Just bear with me. I think he's just going to come back in, hopefully. In the meantime, if you can put your Q's and A's in the questioning box, we can see if we can get Prof. Naidu back.
I think we have to move to the next presenter, Ms. Frost, on Dr. Kotze. Yeah, Dr. Kotze, please introduce the next speaker. Let us carry on. We can try later on with the follow-up with Prof. Naidu. Dr. Kotze, you're still muted. Ms. Frost, I haven't got the CV of Dr. Sharma with me. Please you carry on. Introduce
I
Dr.
will
Sharma.
I will
Thank you.
introduce quickly until it seems like there's a lot of connectivity issues here in South Africa, unfortunately. It is a bit of a problem for us, so just bear with me for a second. I hope everybody can still hear me. Just give me a thumbs up so I can see that there is light.
We can hear you.
We can hear you. We can hear you. Rajan has confirmed that he's got problems on his side, at his institution.
Okay, so yes, we will continue as proposed by Prof. Cox, our SASOM chair, and we will continue to Ms. Sonal Sharma from India, who will be our next presenter. I'm just going to read your short bio, if that's okay, and if I say anything incorrectly, please correct me as soon as you come online. So Ms. Sonal Sharma holds an MA degree in development studies and is a development practitioner specializing in informality with a focus on women's economic empowerment. At the Self-Employed Women's Association, Bharat, SEWA Bharat, India.
Claudia, I'm
yes.
very sorry to just butt in, but I can see that Rajan is back.
Are you online? Okay.
Rajan, can you unmute and we'd like to see if we can hear you. Maybe you can finish your presentation and then I can take over.
Yeah, Rajan, your video is open. Unmute yourself. Rajan, still stay muted. There you are, unmuted,
Yeah.
Rajan. Let's try again.
Yeah, I'm just trying to load my presentation. It seems to have, yeah, sorry about this. Let's see if I can find my presentation.
That's absolutely not a problem, Prof. So you load your presentation, at least we've got you online. And as long as you remember where you were, you continue from there. In the meantime, I've got a question also from Dr. Mkwatle. If I say that incorrectly, I do apologize. Do you know if EPWP, short-term outdoor government-funded workers, go through any pre-employment medical assessments to pick up heat vulnerable team members and or pregnant women as they work during extreme heat during the South African summer, especially in the summer seasons, for example, grass cutting along main roads with more water points or shaded areas to resting. So whilst you get that up and running, can you answer that question for us?
Okay. Claudia, you want to quickly repeat the question? I know where I am now and I wasn't paying attention to you.
Okay, sorry, I will just quickly repeat that question. We will deal with that one question and then we will move on. Yes, it says, do you know if EPWP, short-term outdoor government-funded workers, go through any pre-employment medical assessments to pick up heat-vulnerable team members or pregnant women as they work during extreme heat summer South African summer seasons? For example, the grass cutting along main roads with more water points or shaded areas for resting.
So I don't know for a fact, but I think I can stick my neck out here and say no. If you recall, a couple of years ago, this was not the EPW workers, but police being recruited or people applying for working as Metro Police in Durban, and we had deaths, and these deaths occurred during the selection process when they were expected to do running and exercises assessments during a hot day. So it's not happening. And it is a concern. I mean, we know for a fact that in most government departments, we're not having the levels of medical surveillance that needs to take place for the work that people are employed to do. So I would be very surprised that if there was for these informal workers applying for part-time jobs would be sort of meaningfully assessed.
Yeah. No, thank you for that, Prof. You may continue from where you were.
Okay.
Please.
So my sincere apologies to everybody for those technical glitches. Let's see if I can catch up with the time. But so I showed you the slide just now of the worker cutting sugarcane in the cane fields in Eswatini. And over the course of the period, this is a sort of amount of cane they will cut in that one day. So this is one worker cutting all of this cane. So you can imagine the amount of work that they have to put into this. And I also told you that they start working. Let's find my laser again. They start working at about 6 o'clock in the morning. And at that time, the heat levels are not too bad. They're manageable. But as you can see, as they progress to the day, the heat levels with this high intensity jobs are getting to those thresholds that the ACGIH and NIOSH put down as being dangerous. So by this point in the time, these workers should be only working for about 15 minutes every hour, but clearly they're not. And so it's not surprising that this work by our doctoral student, Sibusiso, found that a large number of these workers were actually dehydrated because they were not taking adequate breaks. They were not properly trained about the breaks. They did not have access to drinking water. And if you look at chronic kidney disease, which, as I told you, in most instances, it's not done, a large percentage of these workers were showing features of chronic kidney disease. So once again, clearly a sign of concern for these. And it's no wonder that we have, 22 million people globally with estimated chronic kidney disease. So moving on from there, speaking about, this is not for the informal sector generally, well, not generally, but, although our legislation doesn't stipulate, it doesn't apply to the informal sector, we know that our laws, occupational health and safety laws, is a challenge to be applied in the informal sector. But having said that, we already have a weak framework for occupational heat exposure in South Africa. In the mining sector, it's not too bad. In fact, it may be considered to be reasonably good. They have a code of practice, and mining companies are expected to adhere to this code of practice for thermal stress. It's not as good. In fact, it's pretty weak for industrial workplaces. So this is the environmental regulations for workplaces. And you can see here, this is basically the sum total of all the legislation related to heat stress and occupational heat exposure for workers. So once again, not adequate. SASOM has a guideline, and I think it's very important. And it's considering that SASOM put out this guideline in 2009, it was already showing some level of foresight on the part of SASOM, because at that point, occupational heat exposure was not a key focus. But I think it is a time now for us to revisit this. And I know SASOM has already started the process of this, but we need to look at improving and revising this guideline. So what are the challenges then for heat protection programs amongst informal workers? We know that in terms of the hierarchy of controls, this is not feasible when we think about heat exposure among informal workers. They cannot control the work that they do. They cannot control the exposures. And certainly you cannot talk about air conditioning or anything of that sort. So it just does not happen. Monitoring and surveillance, workers have no access to healthcare services. And this is, so we can even forget about occupational healthcare services when they don't even have access to primary health services. We found that when we did a study among the informal workers in Durban, an extremely high prevalence of undiagnosed hypertension and diabetes. So they're not even accessing primary health care to be able to manage their health at a very basic level. Biological monitoring, whether this is for chronic kidney disease or acute heat exposure and dehydration, not feasible. When we talk about the basic interventions for protecting workers against heat stress, the three is rehydration, shade, and rest. Even this is not workable. And I think maybe Sonal will speak to some of these things, but with the work that has been done among the informal women workers, because there's poor sanitation in the informal work zones, whether this is agricultural workers or any other sector, women workers don't drink water simply because they don't have safe sanitation access. So you'd think something as basic as drinking water is something that everybody can do. No, it's not as basic as we think it is. And if you're sitting out and you're working in those sugarcane fields, as I was pointing out, those workers are paid by the amount of cane they cut within a day. It's measured. So if you're going to then work in a field that's 1 kilometer away from the shade that has been set up, you're not going to go to that shade, because then that means you're going to lose time and you're going to lose the amount of work that you can do, and therefore you're going to lose income. So some of the things that we think of as being basic may not be basic. And the same thing, changing the work time. We know, for example, from the lessons that Qatar learned from the construction of the World Cup, no work in Qatar is done between 10 o'clock and 3 o'clock every day. Work stops. And this may be feasible in organized construction sectors, but if workers are working in the informal sector, where they have to catch the peak human traffic periods, I think about the vending that takes place in the Warwick Junction in Durban. Workers can't start working at 4 o'clock in the morning because there's no people to sell the products. So they have to be working at the peak heat periods. And so changing the work time may not be feasible for these workers. But then what do we need to do? So I've said this almost every time that I speak about informal workers. The informal economy is an intrinsic part of government and the formal private sector economic strategy. Informal workers do not exist. Informal work or the informal economy does not exist because these workers want to work informally. They exist because this is a strategy to outsource the costs that a normal formal worker incurs in the formal economy. So it is part of the strategy, the economic strategy. And I therefore argue that it is state resources and the taxation of the private sector that must provide the resources to protect the health of workers in the informal sector. It has to be that way. There's no other method that we can do because we know what has to be done. It's a question of where's the resources for this to happen. We need to see at a local government level, how is the informal workspace organized? Where are they located? What are the resources placed within that workplace? Basic interventions, as I spoke about just now, sanitation facilities, continuous water access, shade, rest, must be part of the spatial planning. And this spatial planning must be a responsibility of local government. And without doubt, I cannot specify what additional services need to be provided to female workers, but clearly their needs are completely different. I have no doubt that Sonal will raise this in her talk, but certainly in order to protect the health of female workers, additional services are required. Because, you know, I mean, whatever you say, I mean, a pregnant informal worker is going to continue work until the day she delivers. Not only do we need to protect her health, but we need to protect the health of that unborn child. And so certainly additional services need to be protected. Public health services must be provided, and basically within these public health services, we need to figure out how do we include basic surveillance for the exposures that informal workers are facing with the work that they do. And we need education and awareness programs. To a large extent, informal workers are completely unaware of the risks that they face, whether this is heat or through chemical exposures, etc. We need to make sure that there's some education taking place. Now, for all of us as health professionals on this call, there is a role for us. We know that informal workers are not going to have organized occupational medical services. There's not going to be a managed care operation working in an informal working environment. But for us working as doctors, working as health professionals, we must recognize that there is a problem. And if we are working, whether we've got our professional practices in close proximity to worker communities in informal work zones, then we must realize that when people present to us for problems, whether it's work-related or not, we've got to recognize that they have been likely to be exposed to heat, and we must make sure that we monitor them for these conditions and refer appropriately. Every opportunity we get, we need to make sure that we educate the workers to the risks that they face, and to whatever extent it is possible on an individual basis. It is always a challenge. Water, rest, and shade, we need to provide advice to workers. At least the education part, and they need to then decide how this is going to be implementable in their environment. Then to the role of SASOM. I think SASOM has a very, very important role to play. This seminar that organized by SASOM now is one of those steps. But I think SASOM is saying through the organization of this seminar is that we recognize that the challenges faced by informal workers are formidable, and SASOM must also say to itself, we're going to take a lead to respond to this challenge. And in responding to this challenge, we need to engage with key stakeholders. Informal workers, yes, they're organized. They're organized in a number of different ways, and I think Akran and Clive highlighted this in their presentation. But what, at the level that they're not organized is on the question of health and engaging for health services and engaging for health facilities and policy. And this is the role for SASOM. We need to understand the challenges faced by these workers, and we need to be that middle group that plays the link between the workers themselves and the policymakers and those with resources to direct towards these workers. And as I've already spoken about, SASOM needs to review the guidelines. So some concluding comments. I hope I'm within time. We know that this presents a crisis within occupational medicine generally, and informal workers without a doubt are at the greatest risk. I want to emphasize, we're not only focused on extreme weather events. We're not only focused on heat waves. Heat exposure is an everyday risk. So for example, in the months of June and July, workers in Durban are still going to be experiencing risky heat exposure. And we need to recognize that. And while the acute effects are visible, the chronic effects contribute to a silent epidemic. And these workers are not subject to medical surveillance, but we've got to be aware that this is a problem that's brewing out. I've spoken at length about why government and the private sector needs to be responsible, and why SASOM as an organization needs to play a lead role, working with organizations such as WeGo, such as the other informal sector organizations that are present in South Africa, in various parts of the country, to start to address how we can put together services to support these workers. Once again, a very big thank you to SASOM and the organizers. Thanks to my colleagues from the global network, as well as Sonal from SEWA for this opportunity. And I'm available to answer any questions. Thank you very much.
Good afternoon.
Andre, are you online? Yes, wonderful.
Yes. Rajan, I just want to say thank you very much for this very practical, very comprehensive presentation that you've done on a very difficult issue and indicating all your concerns. I see there's been 4 questions, and I'm just going to run through all of them because I think they're actually linking directly back into what you've actually presented. I'll quickly run through them. Kevin Renton says, I've seen these workers carrying their own 2-liter water bottles. God helps those who help themselves. Then Shumani Pashwa saying, in some areas they do get pre-employment medicals done, but it is very inconsistent and uninformed. Then we're looking at Senikiwa Dlalisa. Many informal workers lack access to traditional employer-based occupational health protections. What innovative financing or delivery models, such as community health programs, mobile clinics, etc., have shown promise in bridging the gap, and how can they be scaled? And then Dr. Damodar Vishni, how do you practically protect them from heat stress? And I think all of these, I think you've actually tried to answer all of them. I think, but I'll just ask the question, looking at the 4 of them, have you got any practical advice, although I think you've actually dealt with all of them?
Yes. So I think, yes, I mean, all of those just highlights the complexity and the challenges that informal workers face. And I think, so as I said, I think the first thing is we need to address the policy. We need to address the policy frameworks that influence these workers. Then we need to identify resources. Now, these things can't occur by the workers themselves, and it requires organizations like ourselves, other professional organizations, non-governmental organizations representing the informal workers to engage with a government and engage with other stakeholders who are resourced to provide that. So that's at the one level. At the individual worker level, the only thing that we can emphasize is, like Kevin says, helping themselves, is water, rest, and shade. Now, the rest periods, for workers who are working for themselves, every time that they take a rest break, it's a loss of income. So it becomes a challenge. So the question is, how do we make sure that we can provide water, we can provide sanitation services close to the point at which these workers are working, so it doesn't become a burden on them to implement these sort of what I would say easily accessible interventions of water, rest, and shade.
I fully agree. I think the practicality of what you're saying now is absolutely so. And there again, it's awareness, without any doubt, that needs to be addressed there. Rajan, again, thank you very much. Highly appreciate it. I think we're a little late, so we'll move on to the next one.
Yes.
But thank you very much. Thank you. Folk, we'll be moving on to the last presentation. I just want to quickly get to my introduction. Okay, our last presenter is Sonal Sharma. And now just a short introduction. Mr. Sonal Sharma holds an MA degree in development studies, and he's a development practitioner specializing in informality with a focus on women's economic empowerment. At the Self-Employment Women's Association in Bharat, Shua, that's India, Sonal has established and expanded multiple verticals aimed at promoting the growth of women-led micro-enterprises and advancing women's land rights. She has led and studied community-driven, knowledge-based interventions designed to build resilience and enhance capacities amongst women in the informal economy. Currently, Sonal is guiding the organization's exploration of intersections within women's work, such as those between entrepreneurship and the global key agenda, and between livelihoods and climate justice. So that's that. Okay. Sonal, if we can I ask you to actually start with your presentation?
Absolutely. Thank you, Dr. Kotze, for the introduction, and thank you to SASOM for this great opportunity, and to Rajan and my colleagues at Viego for thinking of us. I'm going to just take a moment to share my screen. Can you see my full screen? I hope the presentation
looks good, Sonal. Looks
visible.
good.
All right. Awesome. I'm actually glad I'm going last, which is usually not the sentiment shared by the last presenter, but I feel like all the speakers before me have laid the grounds for the world of work within the informal sector, the unorganized sector, their intersectionality with what makes them vulnerable, migration, exposure to the climate crisis, heat stress. So I feel I can dive straight into what Seva has learned from its experience of working with women in the informal sector in India over the past 5 decades. I'll largely be speaking from the findings of a research study we conducted a year ago. I'll speak a little bit about, of course, Seva first, give you a background of the study. I want to start with the impact of climate change and environmental degradation on the lives and livelihoods of these women and how they're adapting to these situations. while the study actually expanded the definition of climate crisis, and of course did not only limit to extreme temperatures, we also looked at how erratic rainfall is one of the most extreme environmental conditions that they are dealing with. I would limit this presentation to looking at extreme temperatures and wider environmental issues, and speak a little bit about just transition, as is the keywords these days, and where are women in this just transition, and for us to make sure that they are not left behind. And I'd like to end with some key messages from the study centering around the importance of collective action for climate justice, one which is led by women. Some of you may have heard of SEWA, but SEWA was formed as a trade union of women workers in Gujarat more than 5 decades ago in 1972 by founder Ela Bhatt. And Seva Bharat was born out of this movement, out of this organization as a national federation of the Self-Employed Women's Association. And the goal of Seva Bharat, and Bharat is Hindi for India, was to spread the movement across the country and not just limited to Gujarat, as loads of collectives and women and other organizations came calling for a similar confluence of the three movements that Seva is widely recognized for, which is the feminist women's movement, the cooperative movement, and the labor movement. And it grew nationally and internationally. Nationally, it grew into different cooperatives and enterprises run by women. We have childcare cooperatives, insurance cooperatives, health cooperatives, agriculture cooperatives, an academy, banks, multiple producer companies, multiple credit and thrift financial organizations. And we also grew internationally, WeGo being one of the sister organizations of Seva. And at present, Seva has a presence of over 3.2 million women workers across 18 states who run hundreds of collective enterprises and run them, manage them, and govern them. Just a quick look into what are the different thematics we work around. Essentially, it's all issues that women workers over the past 5 decades have come up with when it comes to their work. So we work on their grassroots leadership, organizing and collectivizing their women, their financial inclusion, working on their skill upgradation, promoting different kinds of livelihoods, including entrepreneurship, working on their social protection with a key focus on health, childcare, and microinsurance. Equally important is conducting research and making recommendations to policymakers and advocating as a collective for them. Seva's strategy is based on struggle and development. Struggle because it is a struggle to, number one, help a woman in the informal sector recognize herself as a worker, help her recognize her contribution to local economies, to supply chains, and it's taken these 5 decades to grow different organizations that are led by women through different trials and tribulations and development, because organizing and collectivizing is not enough. You also have to help them grow their incomes. So your income security is as important as your social security. Coming back to this study, we collaborated with Social Development Direct, which is a UK-based organization who work on research and advocacy. And while there is a growing evidence base on how climate change is affecting the informal economy, we want to also understand the close linkages that exist between women workers in the informal economy and the natural environment. And we also wanted to look at how different types of workers in this sector are affected by climate change. And finally, we also wanted to understand about this interaction and the role of women's agency, or the lack of it, in addressing this crisis as we seek pathways towards a just transition. And a quick shout out to Olivia Jenkins and Kavita Kalsi, who could not be here, but who've actually written this study, and I'll link it in the text in some time. Like I said, the informal sector, the unorganized sector, women in this sector, all the preceding speakers covered it with great precision, but specifically speaking about India, over 82% of total women working are concentrated in the informal economy. And the unorganized sector actually contributes to over 45% of the country's GDP. And overall, 90% of the country's population, working population, is again engaged in the unorganized sector. We categorized women in the informal sector across 8 different categories. And these women form a core part of SEWA's membership. I wouldn't take a lot of time going through each of them, but just to focus on a few. I know that we've heard a lot about waste workers, and it truly is one of the most overlooked trades in the unorganized sector. They're essential for recycling. They're essential for sustaining the circular economy, for reducing our landfill waste. But they're marginalized due to, at least in India, their lower caste status and income insecurity. If you look at the top left corner, you have agriculture workers. 80% of women's workforce in rural India is agriculture worker. It continues to be the top employer of women in this country. And women are not considered farmers in our country because they don't own land. And that is how the farmer is defined. So you would often find them as agriculture laborers. Also because that trade offers them flexibility and food security. So most of them are subsistence agriculture workers, actually. They're also engaged in animal husbandry as a way to supplement household incomes. Forest-based workers, again, form a huge chunk of populations who live around forest and depend on forests and non-timber forest products to sustain their livelihoods and their lives. Home-based workers, as you see on the top right corner, are the predominant form of workers in urban India. Some of them are own account workers in the sense that they employ their own labor, they invest their own money, they buy their own machinery, they buy their own raw materials, and they're actually quite entrepreneurial. But majority of them are contractual. They work on a piecemeal basis in very difficult conditions, and of course work from home. And so their work doubles as their home doubles as their place of work. Moving on to a few specifics about the study, we surveyed over 1,000 informal women workers in this time period across 4 states. So you see we have highlighted the states of Delhi, Uttarakhand, Madhya Pradesh, and Jharkhand. And these 4 states, we were able to speak with women from urban low-income informal communities, from rural backgrounds, from tribal populations who lived in and around forests. We were able to speak with 307 women through focus group discussions. We did 40 key informant interviews, including with government functionaries, and covered 11 districts across these 4 states. Moving on to the main findings. And we don't want to limit to climate change as a terminology, so we also did include environmental degradation, and we want to look at the impact of such degradation on livelihoods. And we wanted to look at the impact worker by typology of worker. And I think as a previous speaker spoke, this sector is not homogeneous. Even within home-based workers, for instance, there are 100+ different types of trades that exist. So starting off with agriculture workers, because of inconsistent weather conditions, specifically extreme heat, erratic rainfall, uncertain, unpredictable rainfall, they've witnessed a reduction in crop quality. They've witnessed a spoilage of their produce, which has of course impacted their incomes. Construction workers are quite physically exposed to the heat. Their workspaces are outside. And for those working far from home who cannot commute between 2 shifts in a day, you can imagine the impact on their health, as Rajan has covered in depth, on their productivity and on their work hours. But they still continue to work because each hour not worked is also an hour of wage lost. Domestic workers are essentially women who are service providers who work in different homes. They cook, they clean, they care for children, they care for the elderly, they care for the sick. And despite rains, flooding, extreme cold or heat, continue to go to their work. They're commuting early in the morning because they want to avoid that extremely hot part of the day. And because of hot weather, they are asked to do more work without any extra pay, often are not allowed to use toilets, are often not provided meals or water at the workspace. And as you can see, we spoke with a multitude of trades, and 88% of all respondents believe that it's actually hotter in the summer, and 55% have noticed that temperatures are more unpredictable. And it's important for them because predictability also allows them to organize their work, and that's one thing that informality of work does allow, is to avail of the flexibility of the nature of their work, which of course works both ways. For home-based workers, they live in informal settlements, densely packed, poorly ventilated. Temperatures go over 50 degrees. It's actually hotter inside than outside. And this has, of course, slowed down their production, increased spoilage of raw materials. They often cook at home and then they sell something as a street vendor. And they faced several health issues. Street vendors, again, much like agriculture workers and construction workers, work outside. They suffered the most from not having access to clean drinking water and usable toilets. And seasonal temperature changes have actually also altered customer demand. For instance, as you'd see on the right, street vendors in Delhi Delhi was known for its extremely cold winters by Indian standards, and our winters are not as cold anymore. And so they used to earlier spend a lakh or two of Indian rupees and in bulk buy jumpers, warm jumpers, but now there's no demand. And so they have to entirely shift their product in trying to adjust to new market trends, and have actually faced a decline in customers in peak summer seasons because we're not stepping out enough. Waste segregation workers work on landfills, which are actually huge mounds of waste now, because that waste has not been managed properly, and are exposed to extreme heat, pollution, smog, significantly affecting their productivity, and are exposed to harmful fumes. And landfills do really create a dangerous work environment, and it's been covered in depth in the case of Ghana an hour ago. Of course, there's impact on their livelihoods, and then beyond. They are suffering from water scarcity. They are suffering from increased unpaid care work. In fact, 86% of all survey respondents reported an increase in their unpaid care works, out of which 42% reported an increase of more than 2 hours of work in a day. About 60% said that they're having to spend more time in fetching water. Food patterns have shifted, and of course, health outcomes have worsened, as I've said in the past. And there's an increased reliance on purchasing items from shops, consuming chemically treated fruits and vegetables, and that's of course worsening the health problems. 84% have actually reported eating less locally grown food, and this also includes farmers who actually are subsistence farmers and grow fruits and vegetables for their own consumption primarily. Housing again is a big problem, with actually traditional kacha houses offering better insulation against the heat and poorer ventilation in urban slums, worsening their condition. It's because kacha houses in rural areas are made of traditional materials like wood, stone, and mud, and are sometimes coated with cow dung paste, which keeps the building cool. And the materials that pakka houses are made of, cement and bricks, are actually quite inefficient in cooling. And so there's this constant trade-off between addressing to their health concerns and missing out on work because of the very precarity of their work. like I said, they've changed the kind of food they're consuming. They're now consuming more cooling foods like jaggery or sattu. Sattu is it's roasted and ground chickpeas. Raw onions with salt. Street vendors in Delhi are cooking rice and not rotis, as the process exposes them to more heat. They use locally available materials for cooling their homes. For instance, in Jharkhand, which is a largely we went to the tribal part of Jharkhand, where communities depend entirely on forests. And they're making fans out of bamboo. They're creating rugs out of date trees. They're warming mustard oil and putting it on their bodies. And home-based workers in Delhi are actually taking more showers and taking more breaks to prevent heat exhaustion. Again, not all of them would have access to water, or in terms of drinking water, not have access to clean drinking water at all within their household. They may actually have to go to a community tap and access water from there. All these adaptations are not necessarily good, and they are and there are unintended consequences of such maladaptation practices as well. Moving on to work-related adaptations, and the first thing we saw is that they have all changed their working hours. So workers whose place of work is outside, primarily street vendors and construction workers, 91% of both these worker groups reported having altered their working hours. But not all workers have the same flexibility. Agriculture workers who are essentially farmers and work on their own land can modify their work hours. But most women farmers, most women in the agriculture sector are marginal farmers, or they work on someone else's plot, and they don't have that flexibility. Construction workers, like I said again, who work on site during specific hours far from home, cannot afford to take those breaks. Some street vendors who go from house to house collecting old clothes in exchange for utensils are now contacting their customers beforehand over the phone. Construction workers, and this is interesting, we saw that construction workers reported taking up agriculture work when it's too hot, or engage in home-based work, which is much less remunerative. And agriculture workers reported to switching the kind of crops they were growing. So, for instance, growing roses or rosemary or other aromatic plants, because there is an increased reporting of the human-wildlife conflict, which is that receding forests have actually forced wild animals, wild boars, wild monkeys, to start reaching out to agriculture fields and completely destroying fields overnight. There are also, and of course, extreme heat is forcing women and households to seek additional cooling mechanisms. In India, an average low-income family will not be able to afford an air conditioning unit. However, some have gone out of their way, taken loans, and installed them. But because they live in such densely packed communities, while one person's house may be cooler at an added cost, of course, that hot blast from the conditioning unit is now actually being thrown in someone else's house. And so there is no win-win situation that they're witnessing. Adaptations to extreme heat in terms of income diversification. So they're also not only just switching, but also taking on more work to diversify their income. So street vendors are now switching to home-based work, and it is the least remunerative of all trades, street vending being the highest paid work among women workers in urban areas. Forest-based workers are transitioning from forest work to agricultural labor and exploring other sources of income, for instance, selling livestock. And all these workers, and so for a 2% reported need to find a different source of income, especially among construction workers. Some Seva staff members, because all our staff members are actually women from the grassroots with whom we work, and home-based workers. And speaking specifically about just one more thing I'd like to add about agriculture workers and construction workers. So some prefer to take on construction work for a quick income source instead of taking out a loan during financial distress. So they'll take on additional work hours. They'll work up to 18 hours a day in times of financial distress. And that's a pattern we're seeing across the different states that we work in. However, there are solutions devised by and implemented by different community-based organizations, different NGOs, Mahila Housing Trust being one of them. It was also born out of the Seva movement. And what they've come up with is a simple heat-reflecting white paint, which is affordable. It's these women who are themselves covering the tin roofs with this paint, and it's seen to lower the inside temperature by 2 to 3 degrees Celsius, which is a relief for them. Other forms of adaptations include bamboo roofing, which remains durable for actually 25 years and reduces temperature by up to 5 degrees. There's another financial instrument that has been launched by both Seva and non-Seva financial organizations, which is a parametric insurance, and it's coming up across the world, where essentially there's a predefined threshold temperature by the insurer and the insured, over which, if the temperature ever goes, the insured person would be covered. This parametric insurance, while a success, is yet to be financially sustainable as a product. Speaking about forest-based workers, I've covered plenty about agriculture workers. For forest-based workers, it's a combination of climate change, deforestation, forest fires, and what we found is that forest fires are actually largely man-made, in the sense that it's usually people who draw a little bit of a fire or who smoke and leave their cigarettes on the ground that are actually leading to these small forest fires, which then spiral out. It's affected the quality and the quantity of the non-timber forest products as well, which means there is a direct impact on their income, because they largely draw income by selling these NTF products. But forests also hold a cultural significance to these communities, and it's affecting the way they engage with nature, specifically for Adivasi tribal communities. Agriculture workers are actually shifting towards the use of chemical fertilizers, of course, to cope with decreasing yields and incomes, even though they are aware of the negative impact it can have on their health, on the quality of the soil, and on their nutrition. But of course, they need a short-term solution for dropping yields and incomes. Although some agriculture workers have grown this collective conscience on going back to their roots and adopting more organic and traditional farming practices. So even at that extremely micro-localized level, while they are addressing the extreme impact of these environmental issues, they're also trying to cope with it. And there's this constant trade-off between preserving the nature around them and essentially making an income. Migration, of course, is a phenomena we've seen getting exacerbated because of wider environmental issues. Migration from rural to urban areas is increasing, specifically for male family members. And in the state of Uttarakhand, which is a mountainous state, because of this increased human-wildlife conflict, men are seeking jobs in urban areas because they don't get enough of an income or a yield in their own farms. And remittances from household members who've migrated has also become a major source of income for many rural households. But then this means that it has increased women's workload of additional unpaid care work, both inside the house and on the fields. In fact, a 2019 Time Use survey that happened in India, it revealed that Indian women spend 352 minutes a day on unpaid care work, as opposed to men who spend 52 minutes a day on unpaid care work. So that's almost 8 times as men. And that is something to think about. A big point that we wanted to make out of this study was to stress on the fact that a lot of the informal work is actually green work. But in the transition towards a green economy, these women at the front lines of the climate crisis are actually at a huge risk of being left behind. they have a lower carbon footprint. They don't use a lot of resources. They have minimal machine use, and they play a vital role in the circular economy, where they reduce material use, they redesign materials and products to be less resource intensive. Home-based workers specifically contribute to the circular economy by upcycling clothes and electronics. Waste segregators engage in recycling waste materials, promoting environmental sustainability. There's a specific kind of street vendors who go from house to house, buying buying old clothes in exchange for utensils, then fixing those old clothes, re-dyeing them or hemming them, and then selling them in larger markets. And there are street vendors who themselves question that if we stop doing this important work, what will happen to this old stock of clothes that's going to end up in a landfill, untreated, and left there to rot. Agriculture workers, of course, they use limited machinery because they're very small. They work on really small plots of land, and also engage in organic farming practices, which are actually climate smart to begin with. You can see on the right that they really do find reuse of everything available to them. On the right hand side, you see a picture. Essentially, this is cans that they have, empty oil containers that they have flattened and turned into doors. Cow dung is dried out as cake and used as fuel for cooking. Leaves from particular trees are used to make plates and even rain jackets. Yes, these practices are sustainable, but they are intensive in the time and the labor that is expected of the women worker. Without avenues to formalize existing informal jobs, and I know that's a point that's been made multiple times in the past 4 years, these women are going to be left behind. And we've seen this change, this phenomena happening across sectors, and especially in the waste management sector, where high-value recyclables are now being only formally recycled. For instance, mobile phones and other electronic waste. And these used to be, again, the most remunerative for waste segregators to segregate and then sell off. And they're completely left behind in this formalization of this process. So yes, formalization is important, but not at the cost of leaving behind those who've actually done this work and who are the most vulnerable to such changes. Street vendors and home-based upcyclers risk being pushed out due to lack of legal and social protections as we transition to a green economy, and there aren't enough skill upgradation opportunities for these women to take on green jobs as are being created in the current climate. And therefore, support is essential to ensure they're not left behind. As you can see, there are waste segregators who've reported a significant decline in their daily earnings from 700 to 800 Indian rupees to 200 to 300 Indian rupees because of introduction of formal recycling methods. Collective action for climate justice, that really is what we've seen that has worked really well. It is collective action that can drive policy and can cause behavioral change among communities. And the work that SAVA has already carried out is crucial for strengthening women's climate resilience, their collective negotiation abilities, in recommending climate-sensitive practices that they've actually been practicing since time immemorial. And we've undertaken different campaigns and programs, and just I'll look at a few and I know that we're running out of time, I think, now, but we have different states that have, for instance, in Seva Jharkhand, in Madhya Pradesh, these are states that form the central and eastern part of the country. They've launched different campaigns to rebuild their forests. In the state of Uttarakhand, like I said, there's a huge human wildlife crisis, and so all these women have come together. For instance, in a district, 13,000 women, they did a signature campaign, submitted their demands to the chief minister of the state, who actually did hear them, and then gave instructions to one panchayat. These are local community level forest management systems that recognize traditional and customary rights of forest-dwelling communities, and they've given them instructions to give buyers and different kind of solutions to these communities so they can protect their land. And Madhya Pradesh, like I said, 187 villages. We've identified 51 Seva Sakhis, essentially Seva friends or women leaders in their own right, who've taken on the mantle to create awareness about organic farming practices, environmentally friendly practices, how to use natural products to create fertilizers, and creating awareness against the farming practice of burning wheat fields, which is the biggest contributor to air pollution, especially in Delhi and neighboring areas. Seva Uttarakhand is also restoring natural springs. They're called Naulas. And they're natural springs, fantastic water drip irrigation systems. They're stone-lined tanks which catch dripping water from springs and streams, which have been overlooked and have actually fell into disuse. But these communities are identifying Naula by Naula in each village in each district of Uttarakhand and reviving them. And there is only so much they can do by themselves. They ultimately need experts and scientists to come in rejuvenating these old traditional water management systems. So there is this collective consciousness growing across these states, across these women. Women workers they do bear the brunt of the climate change, but can address the crisis with increased agency. They face heavy losses. They are acutely aware of climate change and environmental degradation, but they lack the vocabulary and the scientific understanding of what is happening. Because most of the women we would speak to would say, this is God's doing. This is God's punishment to us. And so they do need to understand the fundamental causation of why this is happening. And there is an opportunity in the just transition to keep them at the center, to keep them on the front, and improve their climate resilience. And we can start by not just looking at climate smart infrastructure, but giving them access to basic infrastructure services, clean water, toilets, proper drainage systems, especially to also address the problem of increasing unpaid care work that women are having to do. Having equal access to digital tools, for instance, mobile phones, to gain access to important information on key alerts, different work opportunities, getting access to adapted financial instruments tailored to their specific needs, for instance, the parametric heat insurance, accessible loan products, for addressing climate change, extreme heat, erratic rainfall, gaining support and mainstreaming their traditional sustainable practices that are getting lost with time, and of course mobilizing via collective observation. I'll end my presentation here. Thank you.
So Noel, thank you very much for that very interesting presentation and the amount of work that which women are doing to actually empower themselves. What I would like to hear is, if we're talking about India and we are talking about empowerment of women, is it still a very paternal type of a system in India? Or can women actually obtain land, etc., etc.?
It is as paternal as you'd think. I suppose for us the end game is not for women to own land, but to first have that voice and that visibility for the work that they do, their contributions to local economies, to sustainable communities, and through that voice, through that agency, they're able to step out collectively. Because what we've seen is, of course, there is strength in the collective. So for us, that recognition by first herself of her own worth, and by the state, by the market, by her husband, by the community of who she is and what she brings to the table is the most important. And then, of course, Seva has created different, for instance, financial institutions, housing finance companies that are, and the government is supporting and promoting affordable finance companies, housing finance companies that are creating products that are tailor-made for women in the informal economy, who also actually may not even have titles to begin with, or formal salary slips to begin with, to actually avail a loan. They're not considered credit worthy. Whereas actually, if you look at credit ratings of women in India, they are better lenders than men. They repay their loans way more and way often than men do. So it's a long journey, but women need to first know what they're worth for that to happen. I hope I've answered your question.
Well, thank you. Yes, I think there's still a long way to go, but I think you are trying very hard, and that's excellent. If we're looking at the questions and answers, and again, thank you very much for that very interesting presentation. And it's a very big country with a lot of people, but I can see that there's a lot of things going on, and thanks for the work that you do.
Thank you. Thank you very much.
Okay, on the questions and answer side, I see we've got three. Two are from Tidu, van der Merwe. It says, Sonal, I think coordinated awareness public campaigns to introduce information to the public in general, and thus informal workers specifically, will go a long way to make these people aware of the exposures and risks, thus enabling them to prevent adverse effects. I think it's a very general point that she's making. Then I think that is very true. But as we've heard today, that it's really looking at specific programs for specific groups of entities, which really will make a big difference. And then there was a question to Don about SASOM, and is SASOM liaising with SASOM, which is really the South African Society of Occupational Health Nurses, with regard to these webinars. I'll ask Don to answer that at the end, and then we can move on to Sharon Fon. It is fascinating how much collective action takes place in India compared to South Africa. Can you reflect on how this occurs in India? Is it spontaneous? Is it organized? What are the characteristics? You talk of friends of Sawa. What does that mean, and what do these friends do?
I'm not sure if I don't know the extent to which collective action takes place in South Africa or other African countries as compared to India. But one thing is for sure, that it's not entirely spontaneous. Now, for collective action to spur change, it has to be organized. There has to be intentionality in the organization you're doing of women. And it really starts, the way we organize women is really through two mediums. We first talk to them about community issues that are common to these women, and we call them mohalla meetings or community meetings. And they come together, and the first thing they say is that the school is not operational, the health center is not taking enough patients. There is this community.
We seem to have a problem on the IT side again. Let's give it a second and see if that can rectify itself.
In the meantime, Andre, I can say from Claudina's answered the question to Tito van der Merwe in the question and answers box about SASOM also included in our circulation list with the webinars. And the answer is yes. We do liaise with, as Claudina quite rightly wrote on the answer, they do get our webinars and advertisements, and they are included in our circulation list, their admin office. So are our other partner occupational health and medicine organizations within the country. But please, if you feel you want to be added to our circulation list, or you know of anyone, please forward the information on, and we can also add them to our circulation lists. Of course, we would like people to join SASOM. That way you are on the list automatically, but we do also have additional information and email addresses we share our information with. It doesn't look like Sonal is coming back, Dr. Kotze. But yes, hope that answers that question in terms of the sharing of information in the meantime.
Sonal is back.
Apologies. Of course, my internet had to go while I was speaking.
Please continue.
I'll just take a minute and I'll close my thought, which is, like I said, we do have two entryways to organizing women. First is around issues of community, and the second is around issues of trade. We conduct trade meetings. So we get home-based workers together, domestic workers together, construction workers together, agriculture workers together, and we talk to them about what their trade are, what problems do they face in terms of employers, in terms of health issues, in terms of risks they're exposed to, in terms of the irregularity of their work. And there are a lot of actually provisions that the government of India has developed for these women, but the last mile connectivity is quite lacking. And so that is where we come in and link these women to social protection measures, to income security provisions, which are not enough, I have to admit. And which is why that collective action over the past 50 years has also led to new legislation being set. So, for instance, India has a National Street Vendors Act, which came into being through efforts of organizations like SEWA, who organized street vendors together. They came onto the streets, they listed down their problems, and through years of constant advocacy and liaising efforts, they were able to get that particular legislation enacted. But which is why in the beginning I said that SEWA's modality is in struggle and development, and one doesn't work without the other. So it is a long journey. I'll stop there. Thank you. Thanks very much.
Thank you very much. Highly appreciated. Continue with the good work. Okay, folk, I think that was excellent, and I think a lot of answers and questions, and I think it was very worthwhile, the seminar. So thank you very much. I don't know if Don wants to say something to close down the webinar.
Thank you, Andre. Well, let me tell you straight away. The knowledgeable persons has changed me from an uninformed to an informed individual now about labor of informal sector. The main that I take out of this is that the 4 Ds is an acronym that we have to know about. We have to know that everything is possible through the e-waste changes of the informal sector. And that is something that we must be aware of. The situation in South Africa is part of an international challenge, let's call it that. But then the last speaker tell us quite clearly that public health or public concern or collective or group action is the only solution within a country. And I'm going to only leave with those 4 salient memories of this, and from there on it is open to everybody and everything. So Akram, Clive, Rajan, Sunil, I feel much more informed, and I'm really appreciated that we were able to make contact on international expertise via Claudina and then Claudia's backup. Andre, thank you for your chairmanship. Claudina, thank you for your chairmanship. Session-based. Lastly, as indicated, remember SASOM's website, all the communication channels, keep your eyes open. We plan another successful, in my opinion, webinar in August. And with that, after 4 hours listening and grasping and sponging, I'm like a sponge now, I'm telling you. Everybody involved. Thank you very much, and I declare this meeting closed.